Hello, hello. Good morning, everyone, and thank you for joining us. If you are here, let us know you're here. Type in the comments, say welcome, say hello, just say something to us and let us know you're here. We welcome you to day 2 of the Africa Trauma Care Conference. Yesterday was wonderful, and today is going to be brilliant. And we are ready. I'm your host again today, and my name is Esther Olainka Bello, and with me is
Elizabeth, good morning, everyone. I hope you had a nice night. As your co-host for today, if you missed yesterday, sorry about that, but all hope is not lost. You can watch the replay on your free time after today's session on all the platforms: YouTube, Facebook, LinkedIn, by searching for Dr. Akin Merino or the Jazz Conference on your social media. And remember to use the hashtag, which is #ATCC 2024.
thank you, Elizabeth. So today we have a rich lineup of speakers on varying topics. We'll have the keynote address by Ajia Uma Ahmed, the Honorable Commissioner of Health, Kaduna State, Nigeria, who will be represented by Dr. Joseph Ike, the Director General, Kat Busa, and a special presentation by the conference chairman and leader of the Africa Trauma Care Alliance in person of Professor Akindoto Merino. She will be presenting a paper on the CADA Sile African approach to trauma care.
Don't miss a beat as we all will be listening to special presentations and success stories of trauma care in the African context. Such a rich agenda we have today. You don't want to miss any of these sessions. I wouldn't want to miss.
Yeah, you don't.
Yeah.
Me too. So
Yeah.
right now, we'll do a little exercise before we start. So wherever you're watching us from around the world, I'd like you to type in the chat box your name, your country, your key point if you were here yesterday. And if you weren't, tell us something interesting about your city. So your name, your country or your city, and something you learned yesterday if you were here. And if you were not here, just tell us something interesting about your city where you're joining us from. And you can remember to use the hashtags ATCC 2024 in your comments as well. So we await your comments and your feedback as we allow everyone to get settled. So speaking about getting settled, I need you to take this time to grab your water, your pen, your notepads, if you have not already done that, and find the nearest restroom to you, like we did yesterday, so you don't have to be looking for it, and then that can make you miss a session. So right now we're going to practice some deep breathing. We did it yesterday, so I'm just going to repeat it again for those who were not here yesterday. I need you to get comfortable, find a seat, and make sure you're seated comfortably like me right now, and sit upright. And what we're going to do is we're going to breathe in for 5 seconds, hold it for 6, and then breathe out through our mouth, slightly open for 8 seconds. So we're going to do it 3 times, but I'll do it the first time, and then you can observe me so you can know how to do it on your own if you've not done it before. But if you already know how to do it, please feel free to join me and let's do it together. So Elizabeth, are you doing this with me?
Sure, sure. I'm ready.
Okay, all
Let's
right.
do it.
So let's breathe in now. Hold it and breathe out. One more time. Let's do it one more time now. Breathing. Hold it and out. I'm sure you already feel relaxed like I do right now.
Yeah.
And if you still need to do it maybe a few more times, please feel free. No rush. So we are now ready to dive in to day two of the Africa Trauma Care Conference 2024. To begin, I invite a professor of psychology and the leader of the Africa Trauma Care Alliance and the chairman of the Jazz Group and the Africa Trauma Care Conference 2024, Professor Akindotun Merino, to give the welcome address. Over to you, ma'am. You're muted.
Hello, everyone. I still don't see the where you're from. Tell us where you're from. Tell us your name. Tell us where you're from. Let's do that first. I see Rose. Rose is here. Welcome, Rose. We need more of you from all of the streams. From all of the streams that we have. Can you mute that? Make sure that we know where you're from across the globe. So I want you to write your names down. Tell us what you do too, so we know what you do. I know it's early. And it is impossible for us to know where everybody is from. So it's a good thing. Okay, now I'm seeing more people. Let's keep writing the names. Welcome, everyone. Invite your friends. Invite all my students in the current class should be here. So I'm calling you all out. All of our trauma coaches. I'm waiting on you. So I know it's Saturday morning. It's early, but we're going to get this. This thing has already started. All right. So here we go. I am so excited to be here today. Thank you, Esther and Elizabeth, for leading this again, for emceeing this day two. This is day two. Day one was impactful. Day one was amazing. I see. Okay, I can see more names. Come on, keep those names coming. Keep those names coming. It is important for us to know that. When we name something, we identify it. So it's important to know that. All right. So distinguished healers, cherished colleagues, and fellow champions of wellness, day two of African Trauma Care Conference has started. Thank you for participating. Dawn breaks on our second day together on this sacred African soil. We gather not just as healthcare providers, not just as mental health providers, but as guardians of hope in communities that have weathered profound storms. If you understand what I'm saying, put yes in the chat box. The tapestry of trauma in Africa tells a complex story, one woven with threads of historical pain, but also brilliant strands of triumph. Our people have long understood what modern medicine is only beginning to grasp, that true healing embraces the whole person, body, mind, spirit, and community. And that's why we're here today. We stand at a powerful intersection where two rivers meet. The ancient stream of wisdom flowing from our ancestors that is rich in this land, and the rushing waters of contemporary trauma science. Our continent faces very distinct challenges. We have generational echoes of historical injustices. We have the ripples of ongoing displacement and conflict. We have a healthcare system that sometimes is not accessible and is not affordable. We have a system that is stretched by global pressures, and economic challenges. Environmental shifts threaten traditional ways of life. We have a strong youth generation that is having to deal with unprecedented burdens. Yet we bring unique strengths to this healing work. We must acknowledge the strength we have in this on this African continent. We have time-tested communal healing practices. We have wisdom that has been passed through storytelling, through ceremonies, through rituals. We have African-born solutions to African challenges. We have the unshakable foundation of our togetherness. Today, we pursue vital goals. We want to create a bridge between ancestral and modern healing approaches. We want to develop trauma care that honors our cultural souls. We want to build networks of support across borders. We want to transform research into practical community solutions. To every healer here today, I'm talking from the village doctor, from the person who has limited supplies, to the elders who keep this ancient healing arts alive, to the community healthcare workers who become families to patients, to the mental health workers and counselors who help children reclaim their joys, to the researcher who is documenting our unique healing pathways, to some of our leaders who are still trying to bridge all the gaps within their communities. I am talking to you today. Your presence here matters. To the educators, to the trauma care worker, to the students, to the parents, to all our faith leaders, all of you matter. Your stories matter. Your well-being matters. This gathering transcends the typical conference. We are a circle of healers, each bringing vital medicine, whether that medicine comes in the form of modern treatment, traditional practices, or the simple power of your presence here today. As you move through today's sessions, consider, what healing wisdom can you share with your circle? What are you going to share with those that you have access to? What new medicine will you carry back to your people? What new knowledge are you going to take back today? Do not waste your attendance today. Endeavor to make an impact and endeavor to be transformed. Let us enter this day with curiosity that honors both the old and the new knowledge, with compassion for those we serve and ourselves, with courage to face difficult truths, with commitment to have collective healing. The work of mending trauma in Africa is sacred. It demands our finest skills. We need to unveil the secrets that we keep hiding, that keeps us sick. We need to begin to be transparent so that we can heal wounds. Our deepest wisdom and our unified strength is what we need today. Together, we weave a new story of healing for our continent. I have a dream that this continent will be healed, that the people will rise up and be transformed, and that today we invite all the access of divinity to influence everything that we do today, that God Almighty will stretch his arms across this continent and begin to champion healing in our emotions, in our minds, so we can hear, so we can see, and so we can do better. Thank you.
Thank you so much, ma'am. Always a pleasure to share the same space with you. Right now, we continue into the conference with a special presentation by Professor Akindoto Merino on the Kadasile trauma care approach. Wherever you are, I invite you to sit and pay full attention. as this presentation is something that will help you connect with your true self and remind you that healing is doable and is possible. Dr. Akindotu Merino, Professor Akindotu Merino, sorry, is a dedicated professor of psychology and a passionate advocate for modernizing mental health structures and reducing disparities. Her extensive career spans academic leadership roles, including being university president in Southern California. She has also contributed significantly to community agencies and hospitals. Currently, she serves as a mental health commissioner, overseeing services for 500,000 residents in the 4th District of Southern California. Dr. Marino is the convener of the symposium, this conference, and the driving force behind the African Trauma Care Alliance, both dedicated to trauma care integration, mental health advocacy, and research in Africa. Additionally, she's the CEO of Jazz Group and the president of Jazz Education Institute, where she provides trauma based training to professionals, life coaches, and mental health providers. Professor Merino's contributions as an author and international keynote speaker and a recent recognition as the 2021 Woman of Distinction by the California Assembly Legislature highlights her impactful career. She resides in California with her family. Please welcome with me for a special presentation, Professor Akindotu Merino.
All right. Thank you for that. Thank you for that, everyone. This is a privilege. This is something that has been a work in progress for years, but we finally have a trauma module that integrates the African story, the African wisdom, and it needs to be part of the body of literature. And so I'm going to just take a little bit of time here to kind of train you a little bit on what it is. All right, what it is, what it's not. So when we're talking about the comprehensive Kadasile therapy model, that Kadasile is grounded in a Nigerian adage, Kadasile Kawatusha. So Kadasile is we're letting go and we're rebuilding. We're going to let go and we're going to rebuild. That's what it's about. It's that when things get very complicated, when there's have all these traumas in your lives, when things are to the point where you don't know what to do or how to do, which a lot of us sometimes, that's what usually happens in life, is that we are in this place where things are complicated, things have happened, and we think we have to keep going. We have to keep moving forward. We have to keep pushing ahead. But there has to be a point where you stop to heal. There has to be a point where you say, I can't go on like this. I have to heal. Because if I don't heal myself, I am going to transport my deficits. I'm going to transport my pain to the next generation. And if you do not want to do that, put it in the chat box that I don't want to transport pain to the next generation. I do not want to transport my own pain to the next generation, because most of the pain that we deal with it's been given to us from the prior generation who did not take the time to heal. A lot of the times you find yourself saying, I'm never going to be like my dad. I'm never going to be like my mom. I don't want to do this. I'm going to be a different person. But then you find yourself being that. You find yourself doing that. Or you find yourself having the same behavioral patterns, the things that you didn't want to do. It could be, it could be anger. It could be bitterness. It could be, it could be your choices in life. Everything is incomplete. You never, ever finish any one thing in your life. And when you look at the patterns in your family, you find that you're not the only one. And we call those things generational curses. It's all about epigenetics. Epigenetics can be passed on to 13th generation, which means that the pain that I have not processed, I can transfer it to my children. They'll reap the consequences of a trauma that they have not experienced, and they can keep transferring that to the. And the last study that was done, they've actually found traces of the traumas, even in the 12th generation, the 13th generation, and the 14th generation. So it can go that far. It can go that far. This is why we need a context that fits us. This is why we need a model on this continent that we can utilize to heal ourselves. Is this making sense, everyone? We need something that we can make accessible and we can make available. And that is what this is about. So we need to first of all define our terms. Let's define our terms. What is trauma? Like, what are we talking about? What trauma is? So everybody will experience a traumatic event. I mean, we're all going to have traumatic event. If you live in this world, you will have experienced a traumatic event. We experienced one globally, which was called COVID, right? That was a traumatic event. Everybody has some kind of traumatic event that they experience in life. It could be an accident. It could be a natural disaster. It could be a kidnapping. It could be a divorce. It could be a death in the family. It could be anything. A traumatic event is a traumatic event. Right? A trauma is our response to the traumatic event. How we respond to the traumatic event. We live on a continent where a lot of the times, or nations where we are not allowed to even process our traumas. We're not allowed to process our traumas. We're not allowed to talk about it. We're not allowed to shine a light on things that have happened. We're going to pray it. And there's nothing wrong with praying. We're going to pray it. We're going to fast it, but we're not going to talk about it. We're not going to process it. And when we don't process a trauma that is not processed, stays a trauma, all right? A traumatic event that is not processed stays a trauma. And so the fact that you don't talk about it does not mean that it went away. The fact that you don't process it does not mean that it went away. The fact that you silenced it does not mean that it goes away. And then we now start living as if we're limping through life. We start living in our survival brain. We start living a life that is a pseudo life, or a less than life, or a very adaptive life, right? And today, I want everybody to just lay down all of their war tools and just say, I am getting ready to heal. I'm getting ready to heal. And that is what today is about. Next, I guess I can do my slides myself, actually. All right, excellent. So the idea of Kadasile is Kadasile. I've been corrected several times. Kadasile Kawatusha is the idea of recognizing the details. Recognizing the details. We are going to let go and rebuild. But before we rebuild, we have to let go. We have to talk about it. We have to process it. We have to shine a light on it so that the things that we've been hiding, they can come out of the closet. Because if you leave them in the closet, then they will stay in your children's closet and your children's closet, etc., etc. We do not want that to happen. All right, we do not want that to happen. And so this is a very culturally sensitive approach to trauma healing in the African context. And it's not, when we talk about African context, we're talking about those on the African soil and the Africans in diaspora. So this is not just limited to the continent. It's for all Black people across the globe. It doesn't mean that other people cannot benefit from it. Anybody can benefit from this. But it was written from an African context. It is an integrative module which blends the Western therapeutic practices with traditional African healing methods. We've gone across this continent to see what works, because we've been healing ourselves for millions of years. We've been healing ourselves on this continent. We know how to heal ourselves. So what has worked, what hasn't worked? And so what we've done is we're going to address traumas in individuals and families and on community level, which is what also makes this module special. It looks not just at the individual, but it also looks at the collective, because you cannot heal an African in isolation. You have to heal them in the context of where they belong. And the therapy, this approach unfolds across 5 distinct parts. Let me move the slide. Well, before I say that, the core philosophy is release and renewal as healing, as key healing components, that we are going to release it. So put in the chat box, release, and renewal. I'm going to release and I'm going to renew. Release and renew. I have to let go. A lot of people that I talk to, they'll say things like, oh, I can't go there. Oh, I can't go there. I can't go there because that hole is too deep. I don't want to go there. You know, parents will say, heal my child, but they don't want to heal themselves. You have to let go. You have to release and renew. Release and renew. Let's put that in the chat box. Cultural adaptation for enhanced effectiveness. I've talked mostly about this. Integration of collective values and community support. Safe and transformative therapeutic space. Holistic approach to trauma recovery. In this land, we know that you cannot heal just one part of you. We have to look at the whole person, spirit, soul, body, community. We have to take a look at those different parts of us. Then I come to the 4 pillars. All right, the 4 pillars of Kadasile. Kadasile. I just like the name Kadasile. You know, well, the four pillars. The first one is preparation. All right, preparation. So let me pull up the module itself so that, give me one quick second. All right, so let's look at the module itself, which starts with preparation. And I'm trying to pull it up, but it looks, where are we? Are you all still there? Are you all writing what I'm asking you to write? All right, there we go. Got it. So the preparation is exactly what it says. That's the preparation stage. That's the stage that we prepare to do the trauma work. The trauma work is a unique kind of work. And trauma work is not just mental health. And this is why I tell people that trauma work is not just counseling. It's not just therapy. It's important that we understand this. For those of you who are clinicians, for those of you who are psychiatrists, who are all of this, when we're doing trauma work, we're going to the exposure. We're going to the place where the wound happened. Did you know that in the DSM-5, the only diagnosis that requires an exposure is the trauma and other stressors? That is that only section. It says something must have happened. A lot of us are diagnosing the symptoms, which is most of the DSM-5 is diagnosing the symptoms. We're diagnosing, how long have you felt this? What are you feeling? What happened? All of those things. We're not looking at what happened. We're not looking at where were you exposed? Where were you exposed? And so when people come to you, they're going to be angry. They're going to be bitter. They're going to have trauma responses. They're going to have, they might have mood disorders. They might have substance abuse. They might be abusing substance. They might have all kinds of DID, dissociative disorder. They might have everything, all right? And we look at the things, we look at the symptoms and we treat the symptoms, right? But we don't look at the trauma. Like, what is it that happened in your past? Because if you don't treat that, that doesn't go away. That will keep coming back, and then there's going to be a cycle that never ends. A cycle that never ends. It's like marriage therapy. You know, when you do marriage therapy and or marriage counseling, they come to your church and they say, oh, you know, my wife is not doing this or my husband is not doing this. And your counseling is, we're going to counsel that we're going to do anger management. We're going to show you, you have to be respectful to your husband. You have to treat your wife okay. You have to have sex with your wife. You have to do all of these things. Nobody's asking, how did you get here? What happened to you? What made you this person? What made you this person? How did you become a bully? How did you become the person who is mistreating your spouse? Let's go there. Somebody put it down. Let's go there. Let's go to how are you this person? What happened to you? What happened to you? How did the well get polluted? So in preparation, so when we're talking about preparation, we want to prepare to, before we deal with that, we need to prepare ourselves and we need to prepare our clients. And so the first thing under preparation is facilitating safety. I want to focus on safety. I want to make sure that the client is safe. So is the client safe in their current environment? Is the client safe in their home? Is the client safe in their community? So I want to determine that. And if I need to start preparing them to be protected in that environment, then I'm going to ensure that happens. So the first one is safety to self. The client has to be safe to themselves. That's important. Trauma can often manifest as a disconnection from body or feelings of discomfort and unease. So then we also need to know, is the client safe in their own body? Are they safe in their own body? Maybe they're dissociating, disassociate. Are they dissociating? Is the client numb? Is the client emotionally dysregulated? I need to understand what is going on in the body of my client so that we can give them the control of their body back. Because a body who is out of control is not going to be able to participate in the trauma work. So we need to give the client control over their body. So we want to be able to establish safety in their environment and safety in their own bodies. That's important. All right. And then the third safety is, are they safe with you as a practitioner? Are they safe with you as a practitioner? So are you trustworthy? Have you established a therapeutic alliance with your client? Because the work we do in the therapeutic process and the counseling process is known as a professional intimacy. Intimacy. Into me, you see. The client will share things with you that they have not shared with anyone else. And so it's a professional intimacy. It is sacred work. We must honor this privilege and hold space and for our clients. All right. So safety in their environment, safety in their own body, and safety with you, the practitioner. The practitioner must know that trust is earned and not assumed. So we need to understand this as we move forward. All right. And so that's preparation. That's first thing in preparation. The second thing is establish confidentiality, making sure that you have something that they've already signed a confidentiality informed consent contract, making sure that that's already happened. You need to assure your clients that they're going to feel safe to share things with you openly, especially when you're working with children and their parents are the one paying you. Make sure that the children know that what they share with you is safe with you. All right. Set boundaries during your sessions. The practitioner will must set clear boundaries that regarding the structure of the sessions. If it's a 45-minute session, make it a 45-minute session. Don't give your phone number and tell them to call you anytime so that you're talking to your client as if they're your friends. That is not part of what we do. You need to make sure that you include the duration of the sessions and when they can or cannot call you. That's important. Then you need to explain the process and its purpose. In this particular module, the practitioner must let them know what trauma work means. Explain the steps, explain how trauma impacts, explain the steps and the processes. This helps your clients feel informed and it reduces any anxiety. Somebody needs to keep me on time, by the way. All right. Second thing is psychoeducation. That is understanding trauma and healing. And I already talked about that. We are going to go over what all of those means. Talk about the hijacked brain. Talk about body rings. Did you know what a body ring is? Did you know that in the sequoia tree there's a ring when you do sections of it? You have the rings when you have the rings around the tree, and each year you can tell what happened to the ring, what happened to the tree. This is the year that there was a flood. This is the year that there was a fire. This is the year that was infestation. This is the year that was very fertile. So you can tell what happened to the sequoia tree by doing a longitudinal section of that tree. The same thing with us. Trauma is stored in the body. The body keeps the score. So the practitioner will have to explain to the client how trauma is stored in the body and how it manifests in different symptoms. So that's important. The third thing in preparation is resourcing. So this is where all of the things that they've told you is happening with them. It could be that they can't sleep properly. It could be that they are angry, they're upset about something. It could be that they're dissociating. Anything they're having uncontrolled thoughts, they're always having automatic negative thoughts, etc., etc. When these things happen, all right, we still need to resource them. And that is part of preparation. The third thing we do in preparation is resourcing, which means that you're going to teach your clients the techniques and the skills they need to actually get some relief and get power back. One of the things we do is the breath work, meditation practices that calms the nervous systems. So we're going to do all of the grounding techniques. We're going to do something called an African mindfulness technique. Those of you who don't know what that is, you might want to take the class. That we're going to do African mindfulness techniques. We'll do a lot of physiological regulations. We'll do the hot and cold therapy. We'll do the traditional and modern approaches to this. We're going to do tapping techniques, which is important, and the traditional African practices in terms of the drumming. We can use the bata drum, and that can become like a white noise that we can utilize that for. We'll focus on physical and brain wellness. That means food is health. So we encourage healthy eating. In Africa, we have organic stuff. So making sure that we have a diet that is rich in nutrients, that supports cognitive function and emotional well-being is important. Hydration, water is healing. We have water that surrounds us here. I want to make sure emphasizing the importance of proper hydration for brain function. Your brain needs water for it to work properly, to create all of the chemicals effectively and efficiently. All right. And then there's a trauma shake, which is movement, which is making sure that you're moving your body. Everybody move your body right now. Move your body. Everybody move your body wherever you are. Do some kind of shake. You have to shake the negativity out of your body because trauma is stored in the body. We need to shake the negativity out of the body, and we need to connect to joy. Connect with joy. All right. So any type of outdoor activities is also important. Taking walks, running, gardening, leaping, hopping, whatever you need to do physically to reduce stress and improve your mood. All right. And then it's this African drumming, the batadum, the drumming. That is something that we need to embrace. In the U.S., in California, I went to a conference. Actually, this is not just a one time. I was at a conference one day, and they had invited the South African drummers for a therapeutic time, and people were just dancing, and so that you're doing the drumming, and they're doing the drumming, and they're doing the drumming and doing the drumming, but you're dancing, and you're just feeling free. You're doing your movements, you're doing all the stuff that you can do. You're not being cute, like you don't care about the person next to you. You're just releasing all of the stuff, and that is healing in it. We drum all the time. This is why when people come from churches or parties, they feel good because you have released all of those negative energy out of you. So that is one of the resources that we have. So that is all in preparation. That's all preparation, just level one. All right. And then we are going to move to the pathways of pain. All right. The pathways of pain. In preparation, we're not dealing with the traumas. In level two, we're going to deal with the traumas, pathways of pain. All right. So the first thing we're doing is we're going to take a trauma inventory. All right. Well, that's going to provide a very structured format for listing our traumatic events. What has happened to you? Your client is going to create a detailed inventory of their traumatic experiences. That is what we want to do. All right. We want to make sure that this is just listed. It's just a list. They're not really going into the stories yet. It's just a list. We just want factual information with not the emotional responses. So basically, you're going to say this happened, this happened, this happened, but you're not going to tell the story of it yet. All right. So that's the first thing that we do in this particular section. And then the next one is we want to categorize it. So any personal traumas that happen, accidents, assault, you categorize them. Any family related ones, loss, abuse, you want to categorize those. Any community level ones, natural disaster, kidnappings, conflicts, you categorize those. So that we want to have those in categories. And then you look at those that are cultural and they're historical. So colonization, systemic oppression, all of those are another category. So we're looking at all the intersections of pain. When we talk about pain in Africa, it's not just the pain of your own pain of what happened to you. There are pains that happen to you. There are those that happen to your family. There's those that happen to your community. And there's also pain that happened to us as in a continent. Okay. And so we cannot under stress, colonization. Colonization is real, and it's still rearing its head in different nations in forms of post neocolonization, in terms of internalized oppression. Those things are still happening. So the colonizer might have left the countries, but they left their images on those countries, and they've left their images on the continent. And some of us don't even need the colonizer to oppress us because we keep oppressing ourselves. That is the power of internalized oppression, and that we need to address those even in our sessions. All right. And then identifying the patterns. How did these traumas occur? So we're going to identify those. Are they occurring? We want to look at relational systems of pain. All right. So identify the impact of family and community systems on the client's trauma. This is one of the Africanness of this particular module, because we have to look at it through those systemic cultures. All right. So we're going to explore the collective expectations and roles that have contributed to the individual stress. Some of you can talk to us about that. And then the next thing we're going to do is we're going to do screening and assessment. That's why we're going to do what is co-occurring, what is comorbid. We look at what is co-occurring, what is comorbid. We want to look at, a lot of traumas will co-occur, all right? And so we want to look at that. And if there's any other comorbidity, so trauma will co-occur with depression, anxiety, substance abuse, eating disorders. Sometimes people are diagnosed with DID, even though they're not looking at their trauma. Sometimes people are diagnosed with attention deficit and not looking at it through a trauma lens. I submit that we need to look at some of these things through a trauma lens. All right, we'll look at the medications, how many medications your clients are on, and then for you as a clinician, for you as a coach, for you as a counselor, you need to acknowledge and validate. You need to acknowledge and validate. Recognize your client's strengths in listing these experiences, in talking about it, and validate it and normalize them, the things that they're feeling. If somebody's cutting themselves, normalize it. Of course, the reason why they're cutting themselves is because they need to feel something. So this is normal for what you're experiencing. We want to affirm the importance of this step into this healing process, that they're coming into this healing process. And the number 3 is integrating traumas. All right. The reason why something is traumatic is because it has not been processed properly. All right. It has not been processed properly. So we want to look at the healing. We're going to look at healing practices. The first one is mourning and grief. A lot of people have been grieving for a long time. They just don't know it, because grief is internal and mourning is external. So when we're talking about grief is all the losses, the dreams that didn't come true, the person who said they were going to be with you to the end of time but they left you, the pain that you experienced in the abuse that you suffered. All of this are losses, and they begin, we're grieving them. Our soul grieves those things. All right, so you can mourn. We're grieving the tangibles. The loss of a loved one, the loss of a job, the loss of a marriage, the loss of a limb, the loss of anything like that. Those are tangible. But then there's also intangible ones, like I talked about. The dream that never came true, the loss of your safety, the loss of your innocence, the loss of your virginity, the loss that was taken from you, snatched from you through a rape, the loss of all of those things. All those things, they do not go away, people. They stay with us. Those losses are being grieved. And in this practice, we give our clients permission to grieve, to mourn them. So mourning is how I externalize the grief. So we need to mourn. And so you're going to take them to mourning. All right, we're going to reprocess through storytelling. We tell stories in Africa. Storytelling is a powerful tool to reprocess the traumas. So the client is going to tell their story, and you are going to listen to it, to the story. All right, you're going to listen to it. You're going to integrate them into the client's life's narrative. That's important. And we're going to reprocess through letter writing. We're going to reprocess through testimonials. We're going to reprocess through the empty chair technique. We're going to reprocess through all of these methods, and the practitioner role is to bear witness. Your job is to bear witness. You're going to bear witness. You're going to facilitate. You're going to provide a very non-judgmental, empathetic presence that validates your client's emotions and experiences. It's a very deep work. Is a very deep work, because we go back to the root and we uproot what the thing is that has been injuring you. We're going to go back and we're going to reprocess. We're going to go back and we're going to heal. We're going to heal that client, and we're going to emotional processing. We're going to compassionately go back and redo the history of what happened with our clients. So rituals for honoring and healing intergenerational traumas. So we're going to address those intergenerational traumas so that we can say it stops here. All right, it stops here. So we're going to help the client develop or participate in rituals that acknowledges the history of their traumas and foster healing across generation. Because the truth of the matter is this: just as you can pass down pain and traumas, you can also pass down the generation healing and restoration and all the beautiful things in life. All right. In this practice, we're going to have forgiveness practices. We'll talk about forgiveness is for you, not the other person. The next one is spiritual connection. This has a spiritual component to it. We're going to incorporate practices to connect with ancestor or higher power. We're going to look at spiritual beliefs, systems of the client. All right, because we believe that there's another level of life, that if you can go to the fourth dimension, that things begin to change. And that's where you can connect. That connection will provide your strength, it provides guidance, and it provides continuity that is beyond your limited space. Does this making sense? All right. And so we integrate the spiritual practices. There's prayer, there's meditation, there's traditional rituals, and we'll integrate it into the healing processes. And we will talk about this with the client. And then part 4 is the crucible. Part 4 is the crucible, beyond the crucible. That is flourishing. There's this whole idea of post-traumatic growth. What happens after the trauma? This flourishing, that we're not just surviving anymore, but that we can open up to life, that we can become who we're supposed to become. So when we tusha, we're rebuilding something different. There is a scripture in Jeremiah, and Jeremiah was painting a picture of God. And Jeremiah said that God he likened him to a potter. So we went into the potter's house, right? So we went to the potter's house, and this potter is supposed to be God. The potter is supposed to be God. And what he's doing is he's taking clay and is molding something. And then all of a sudden he looks and he says, oh my God, something happened. Something happened to what he was creating. It wasn't what he intended to create had been marred. Something had happened to it. And the potter did not, the potter did not lament over it. The potter did not say, he just started rebuilding a new one. So if man can get messed up in the hands of God, I mean, think about it. If man can get messed up in the hands of God, how much more you and I? Things can happen. All right. If we live in this world, we're going to experience all of this mess, right? But we can rebuild. So the potter began to reform something new. He began to reform something new. So this section is going to focus on the client's ability to grow and integrate into something totally different. All right. Something that doesn't even look like the past. It's post-traumatic growth. It's the establishment of a long-term support system. It's the establishment of a long-term system that is different from what you even knew before. All right. So a lot of people will experience something called survivor's mission. They want to change the world. They're going to turn their pain into purpose, their test into a testimony. They're going to become what do you call it? Advocates. They're going to become advocates. They're going to be those who want to change their world. And your job as a practitioner is to help your client explore how to live this new life. All right, that happens. How did I live this new life? A lot of your clients are not going to, they didn't know how to really handle life before. How do you do relationships? How do I show up in my life? They don't know how to do that. So in this level, they're going to learn integration. Reintegration. How do I reintegrate myself? I've been hiding. How do I assert myself? How do I self advocate? This is what this session is about. And then there's also ongoing support. So the regular rituals and practices for maintaining their healing. These are the things that you're going to talk to them about. You're going to establish long-term support systems and follow-up care. You don't just dump your clients and say, you no longer have depression, so go away. No, that's not how this works. This is a very holistic, comprehensive module. All right. Well, you're going to you're going to work with the clients to live this new life, if this makes sense. And that is the beyond the crucible, that you're going to flourish beyond the crucible. And of course, I was saying all of that without sharing, without moving on to the PowerPoint for you. It's all in this PowerPoint. And that is the end of that. I hope you learned something. So put in the chat box if you appreciate this module. Put in the chat box, and I think they're telling me it's time to go. So, but I did cover all of it. So thank you very much for your time. And I invite you to come to JARS to learn this. Come to JARS so we can train you how to do this certification. All right. Thank you very much. Esther, where are you? Okay.
I'm here, ma'am. Thank you so much for that wonderful presentation. It's always a pleasure to listen to you, and especially being introduced to the Cardasle approach. Next up, we have our second keynote, or our second keynote for today. It's Ajia Ahmed, and she's ably represented by Dr. Joseph Ike. We can have him up right now, but I would like to read Ajia's bio to introduce her and her speech to us. So, Ajia Katume Ahmed is a distinguished leader with over 36 years of administrative experience dedicated to public service and improving governance. She's currently serving as the Commissioner for Health in Kaduna State. She has made significant strides in healthcare reform and community welfare. Her career began in education, where she progressed from a devoted teacher to serving as Permanent Secretary, Director General of the Kaduna State Schools Quality Assurance Authority. During her tenure, she implemented transformative reforms that elevated the quality of education in the state. Known for her resilience and passion, Ajia Uma continues to drive positive change in her community with a deep commitment to the health and well-being of the people of Kaduna State. Please welcome with me, representing Ajia Uma, Dr. Joseph Ike. Dr. Joseph, are you here?
Yes.
Okay.
Good afternoon, ladies and
Good
gentlemen.
afternoon.
Congratulations on what I believe has been
Okay, I think he's having a bit of a network problem. Okay, while we wait for him to come back on. Okay.
Are we together?
Um, okay, yes, we can hear you now. We lost you for a bit.
All right, great. So I was saying that a quick apology for the brief.
Oh, we can't hear you again. Or I think we lost you again. Okay. I think while we wait for that to be sorted, we would have success stories from our students, um, Kaka Yakura and Abdullahi. If you're here, okay,
Mhm.
he's back now.
Yes. Sorry,
Okay,
yes, I was actually a bit in transit,
okay,
and the network is a bit poor where I am. So
okay.
I bring you greetings from the Honorable Commissioner of Health of Kaduna State, uh, Hajia Umar K. Ahmed, and from all of us in Kaduna State. We are very pleased and we are very honored to be part of what we believe is a very important program and what we hope would be expanded to probably an in-person meeting that would be held sometime in Kaduna State as well. Um, we um, I was going to read the speech by the Honorable Commissioner, but it seems that every time I open up that speech, we lose out on the connection here. So I will proceed on the essence of the speech without reading it word for word, but I will forward the Honorable Commissioner's speech to the organizers for your record. Um, this keynote is not the time to explain what trauma is. I think we all here present understand what trauma is. And when we talk about trauma, everyone knows trauma implicitly. We know that trauma is simply an injury. The problem is that we only typically conceptualize trauma as a physical concept, meaning a physical injury. But every one of us has experience of an injury that hurts just as much, possibly even more than physical injuries would, um, but are not physical in nature. These are the kinds of trauma we're talking about. And these are the kinds of injuries that for so long in this part of the world have gone unnoticed, have gone unrecognized, have gone unacknowledged, and most importantly, when it comes to the healthcare setting, have gone uncared for. Um, True, just like most physical injuries, with a little bit of first aid, will recover. So also a lot of psychological trauma have the capacity to recover through our personal resilience. Um, but as we look at the reality of our social context here in Africa, more so in Nigeria and, of course, in northern Nigeria, we understand that the circumstances of day to day life, day to day living, have become progressively more and more difficult. This would be similar to saying one has a physical injury and the physical environment around that individual has gotten progressively worse. It would not be wise to assume that there will be a remission of that physical injury. What would rather be assumed is that the injury will get worse and probably lead to something else if not managed. This is the mindset that we must also take when considering the situation with trauma in Africa, in Nigeria, and in northern Nigeria in particular. Things are not getting better. We hope we're doing everything we can for things to improve, but hope is not a strategy. And so it is time that we begin, particularly as healthcare professionals, to look at how do we provide care for psychological trauma and understanding that the impact of psychological trauma could also play out in physical ways and could affect every other aspect of an individual's life. How do we build this care for trauma into our healthcare systems? We don't want a situation in Kaduna or anywhere else. We're not advocating for a situation where only one facility in a city, in a state, is capable of handling issues related to trauma. Not at all. What we seek is trauma informed care across the health sector. We want healthcare professionals to build their capacity to understand, to appreciate that everyone who walks in is likely dealing with the consequences or the effects of some measure of trauma. As such, they must be, as a healthcare professional, able to screen for and respond to the trauma that this person may or may not be affected by. This concept of having our healthcare system sensitive to issues of trauma is what we know widely as trauma informed care. In Kaduna, um, in partnership with the Jazz Education System and Professor Merino, we are working through the Kaduna State Bureau for Substance Abuse Prevention and Treatment to begin to build the capacity of the health workforce to become trauma sensitive and to be able to provide trauma informed care. Um, the work that Professor Marino has done has had or will have extensive impact on the people of Kaduna State. And for that, on behalf of the people of Kaduna State and the government of Kaduna State, I would like to extend a very big thank you to Professor Marino. And while we know that you are doing so much already, we would use this opportunity to ask that you do not tire out, but you rather do even more. Because as you are well aware, the work ahead of us is so much more. While we, as part of the Kaduna State public health system, commit to expanding and extending your effort, ensuring that where you provide the capacity, we would provide all the necessary structures and whatever it is that is required to ensure that this capacity is put to use in service of the people of Kaduna State, such that we become a model of a public health system that is trauma sensitive and trauma informed. The African Trauma Care Conference 2024, we believe, is groundbreaking, is innovative, and we hope will be the beginning of a lot more great things to come in this space. Thank you so much for having us, and thank you for the work that you're doing. And we encourage all the participants to give their best to this conference and make it the huge success that we are certain that it would be. On behalf of the people of Kaduna State, I once again extend a heartfelt thank you. And on a personal note, I would also like to say thank you very much for having us on here today. Thank you.
Thank you so much, Dr. Joseph. Through all the hurdles, you still made it to speak to us today. We deeply appreciate you and Hajia Ahmed for your input. Greetings to Hajia and the entire Kadbusa community and the health sector in Kaduna State. Once again, thank you, Professor Merino, sorry, for your wonderful presentation as well. We do hope that all of you listening will sign up to get trained on how to apply the CAD-DASLE approach in your various practices and fields. And if you have any questions, either from today or yesterday, or from any of the sessions, or you just want more information on getting training, kindly put them in the comments or send us a message via our website or social media, and they will be attended to. So now we'll be taking success stories of trauma care in African context. And for that, I now invite Abdullahi Musa and Yaya Kakura. Welcome, Abdullahi and Yaya. Are you here? Okay, I don't see Abdullahi. Is Abdullahi here? Oh, okay. Okay, I think it's full now.
Yes.
Okay, all
Yeah,
right.
welcome.
Oh, you
Yeah,
have the
welcome, ma.
floor.
Good. Okay. Good afternoon, ma. Good afternoon, Professor. Indeed, a gift from Nigeria to the world. It is when I have enrolled into this program, I just understood that I realized that some of my clients have experienced a traumatic event. So, are you hearing me? Hello,
Yes, we
hello.
can hear you. Go ahead, Abdullahi.
Yes, we can hear you.
So for now,
You can hear you.
okay. So for now, I thank God two of those two of those clients, they are already coming for their section every week. So we have addressed those issues, and the result we are getting now is far better from the previous result. I want to say thank you more again to Professor. And also, during my stay at the Jazz Institute, it helped me to discover my trauma through my stay at the Jazz Therapeutic Institute. I unexpectedly discovered my own traumatic experiences. As I learned to support others, I realized I had two unresolved trauma. This revelation was both challenging and liberating. Also, recognizing my trauma allowed me to better understand of client struggles, as well as develop empathy and compassion. Also, it allowed me to improve my relationships and communication skills. The integrated trauma care coaching program opened my eyes to understand the importance of self-care and self-awareness in trauma work. And also another success story is that at the PHC where I work, I came across a community health worker who is like a colleague. She is struggling with a vicarious trauma. She reported feeling emotionally drained, disconnected from patient, and also questioning her ability to continue with her role. So through the integrated trauma care coaching program, I supported her in identifying and managing her triggers. And also I support her in developing self-care practices, for instance mindfulness and journaling, as well as grounding techniques. Also, I support her in establishing a healthy boundaries with client. As a result, she reported improved relationships with client. Also, she increased job satisfaction. At the end, lastly, I wish Professor Merino a safe journey back to her respective destinations. Thank you, ma. Thank you, Just Institute, and thank you, Khadija. Okay.
Thank you so much, Abdullahi. We appreciate you. That was such
Okay.
a very pleasant success story. Just to let the rest of us know, please, that we have 2 to 3 minutes each to give us our sharing. Okay, over to the next person.
Okay. Good afternoon, everyone. I'm Kakayakura. I'm currently a clinical psychologist in training in the University of Lagos, and I am currently doing my internship in Federal Neuropsychiatric Hospital, Yaba. Yes. So
Come on this.
I'm also currently a student of JAS Institute, taking the course Integrated Trauma Care. Yes, to become a trauma coach. Yeah, so let me start by saying in 2021, I worked with an NGO, Mexico International, that was in Borno State, Meduguri. I've been in Lagos all my life. I was born and brought up here. I did my primary, secondary, and university here. But during NYSC, I was sent to Abuja. Then from Abuja, I got this NGO job, and I was like, this is an opportunity to touch lives and to inspire people, to reach out to people. So I took up the job in Meduguri. So I moved from Abuja to
On the
Meduguri.
ring light now.
So I worked in the protection department where we were handling gender-based violence cases, domestic violence cases, and then we had an officer that was a trauma care coach who was also taking up that part. So there we handled different cases about the IDP, the internally displaced persons. We go to different local government, the rural areas that have been demolished and destroyed by the insurgency. We go to reach out to the homeless people there, people who are traumatized by the experience, people who literally don't have anything to clothe, even clothing, good clothing to wear, or even food, daily food to eat. So we're taking care of these people. We're reaching out. There were different departments in the NGO. They were taking care of others, like the shelter and food and nutrition and others. Then we reached out to the people like that traumatized. So we talked to them. Maybe some of them were going through, I can remember cases that we handled. There was a woman that she experienced being thrown out by the husband because of the insurgency. He was in Meduguri, he had an accommodation. They were based in Juraria in Bama, and she was thrown out with the children. She didn't have anywhere to stay. So she was basically staying in the camp, the IDP camp. So we reached out to so many of them. We talked to them about trauma, and some of them started getting healing. And then there's one peculiar one that still like sounds like one that is really dear to me. She was married, and then I think for the first time she had a baby, and the baby was physically challenged, and because of that the husband divorced her. Then she had the second marriage, and in the second marriage she was thrown out because her best friend took over the home and all. So the husband got married to the second wife. So she was so traumatized that she was expressing depression. She developed bipolar disorder. She was literally just down. So we had to refer her to a psychiatric organization for stabilization. Then we started seeing her in the NGO and all. So personally, that's by the way. On my own too, when I started this integrated trauma course, I realized that me myself, I'm actually traumatized. Let me say, in my own case, I faced vicarious trauma as I learned from Professor Merino's class. May God bless you, ma. So I was actually I wanted to study medicine. So all my life I wanted to be a doctor, medical doctor, medical doctor. So I finished secondary school 2008, and then I got admission into the university in 2011, 4 years after, for medicine, University of Lagos. Then along the line, I found out I was struggling. Then I had to repeat 200 level. Then on my way to 300 level, I got withdrawn. That's if you calculate from 2008 to 2011, I got admission. From 2011 to 2015, I was in the university struggling with medicine. Then I finally got withdrawn in 2015. Then I didn't know what to do with my life. I was down. I lost so much weight. My mom cried for 3 days straight. So she was like, "What's going on with you?" She said I slept. Like when she watches me sleep, she always felt pity. So I later, after some months, I recovered, and then I decided to do my transfer. So I transferred to psychology. It was a really traumatic experience for me because even till date, after then, I've graduated as a psychologist now. Right now, I'm running my master's. Even till date, when I see medical doctors, I'll be like, "You're supposed to be this." Then there were cases where I had relationship cases, like 2 people who were my friends when I was a medical student. One of them actually called and said the elder brother is in the UK and he wants to sponsor us to the UK. And because I'm a medical doctor. So I told him, sorry, we've not been in connection for years. I finally didn't become a medical doctor. This is the case. And he was like, sorry, I'm actually looking for a medical doctor for a wife. So another case happened. He called me and he was like trying to find out, are you not a medical doctor? I said, no, I'm no longer a medical doctor. I'm now a psychologist. He was like, I thought you were studying medicine. I said, this is my story. And I explained my story. And he backed out. So I was really, really traumatized until I got to this trauma care class. And Dr. Merino talked about everybody can be traumatized. You can be traumatized, and trauma is about what goes on inside of you rather than what happens to you. And also, I realized that. So I'm traumatized. Then we talked about vicarious trauma, and I'm like, so I'm vicariously traumatized right now. Then I realized that I needed to speak out. Then there was a class that we had, trauma outline, and I got a message from Professor Merino, and she said if she explained everything to me, what I was facing, and it was exactly what I was facing. At first, I didn't even realize it. Then she said if I need help, I should respond to this mail, and we'll take it from there. So since then, it's been wonderful. So I want to say thank you very much to Jazz Institute, and I want to say a very big thank you to Professor Merino for bringing up this program. It's been wonderful. It's really been wonderful. And I also want to say a special thank you to Mrs. Ayu Ojelabi. Mrs. Ayu Ojelabi, I'm currently with her. She's the founder of Enable Wellness Foundation, and she took me up. So she introduced me to this program. So I want to say a special thank you to you, Ma. You don't know what you've done. Right now, I can say, even if I can't say I'm fully healed, I'm healing. And I'm also reaching out to people. There are people that I've met during my work in the NGO that I've been able to realize that this is what they need. And those ones, even some of my officers that are working there, that I don't know that they really needed this trauma care class. I called some of them and I told them about it, and they were like, they are interested in the next class, they're going to take it up and all. So thank you very much.
Bolu Atife, you can go
Bola,
ahead.
are you there?
Yes, I am.
Okay.
Good afternoon. Good afternoon, everyone. My name is Bolo Atife, as you've already heard, and I'm a clinical psychologist. I work at the Federal Neuropsychiatric Hospital, Yaba. I also work with a private practice in Lagos here. I will not go into whether I won't go into my story in detail, but I would talk about how, my experience with being a student at Jazz Institute. And I would say it's been wholesome speaking to almost like a reminder of why I am doing what I'm doing. And in every class that I attend with Prof, it's it's a new thing coming up. There is a new thing to be learned, and there is a new reason to stay doing what I'm doing. I love the passion and the compassion in which, all of the tutors have carried out their duties. Is almost as though you are where you're supposed to be. And then I'm what's that word now? I enjoy seeing almost like I see Professor Marino. I'm like, yes, this is who I want to be when I grow up. So it's been wholesome. It's been beautiful. It's also helped me see the world in a different light with more compassion than I typically would. I I mean, yes, at the hospital we treat psychopathologies, but more than treating the pathologies or more than just talking to people, there is a depth to it, knowing that okay, something happened. There was a major emotional wound that happened with this person, and it has spiraled into this. And not just knowing what happened, but knowing how to help them out of it. I think the compassion is at the core of trauma work. Is knowing that okay, there is pain there, but you don't have to, heal alone, and you don't have to work through it alone. You don't have to walk into it alone. There is passion, there is compassion, and this taking this training has really opened that up for me more than I even thought was possible. So I'd like to say thank you to Jazz Institute. Thank you for this opportunity. Thank you for existing so that people like us can tap into the privilege such as this. So that's it for me. Thank you very much.
Okay, good afternoon, everyone. I want to speak about my experience, and I'm going to talk about two success stories. They are very outstanding for me. I have a lot of success stories. Before I did the integrated trauma care coaching at JARS, I was trained as just a psychological first aid. And one day I was scrolling through Facebook, and I saw, I think it was Professor Moreno that posted something on Facebook, and it caught my attention. She was talking about this trauma training that they do at Jazz Traumatic Institute, and that was how my story began with Jazz Institute. And before that training, I will just say I was doing more like freestyling. I didn't really understand how these things worked. And for psychological first aid, is just you just do like the basic things and you move on from there. So when I joined the training and did the course, and it was so amazing how first of all, Professor Merino she was like pouring out everything on the inside of her. And that's one beautiful thing I learned from her. And I understood how trauma worked, and it helped me to become more empathetic, because she said, there's something she said one day. She said, every bad behavior you see, that person is probably coming from trauma. And it helped me to begin to see people through that lens. And I always tell people now that my favorite people are those people that you feel are naughty, those people that you feel are rude. They're my most favorite people, because every time you sit down with those people, you would see that there's a hidden story behind them. One of my success stories is, there's this guy that schools in one of the universities in Nigeria. I would not say this university, but he was having struggles in school. In fact, the first day he spoke to me, he said that even that for every exam he writes, that he always fails. That means every session he writes his exam, he always fails. He has to repeat the exams again. And he told me that even this one that he's writing, that he knows he's going to fail it, and I just began with him. And most part of the therapy was he had me to sit down and listen to everything he had gone through. And I supported him through his healing. And just last week I was just sitting down and I saw a message from him, and I opened it and I saw that this, when you graduate, you have this your mates sign on your t-shirt, and that was what he's just sent to me, a picture of that. And it was so exciting to see that. And another one is there's somebody that is on my Facebook page. I remember when we finished our training, professor told us how we should be like ambassadors of mental health. We should create awareness. And if you follow me on social media, you know that that's all I post about trauma care. And someone posted something recently and tagged me, and the title of the post was trauma. So she started by saying that she used to see that Elizabeth post about trauma, and so many times she was always running away from the post. And but she knew deep down inside that she knew she had to address the traumas that she had in her life. She had traumas that goes far back as 16 years ago. And she said that she had to go back and sit down, and with everything that was posting, it helped her to sit down and address her traumas, and she began to process it. And that for me was a very big thing, because normally when you post stuff, sometimes you feel that it's not getting to the right people, or it's not getting to the right audience, but it did a lot to me. And I want to thank Jazz Institute for what they are doing. Thank you, Professor Mirino, for opening up yourself and opening up the institute for us in Africa. I think if it wasn't for you coming up with this, I don't think it would have been we would have been here. And I think I would say because of you. I was saying it yesterday. I said this year, I know most of us that are coming from the Jazz Institute, we did at least something to talk about trauma, to celebrate the World Mental Health Day, and also the Trauma Day too. And with that, I hope we are ready and we're energized as we move on. Next, we'll have we are going to have Mrs. Yinka Ogunde, and I'm going to be reading her biography. Mrs. Yinka Ogunde.
Sorry, Elizabeth.
Okay.
Sorry, we are having Apostle Busola next.
Okay. Sorry about that. Yeah. Okay.
It's okay.
Okay. So where I'm going to be reading the biography of Apostle Busola Jegede. Apostle Busola Jegede is an ordained leader with a strong prophetic calling and a seasoned empowerment and transformation coach. She graduated with a BSc in sociology and anthropology from the University of Ife, and later qualified as a chartered accountant. She became an entrepreneur in 1996, leveraging her hands-on experience to help women identify business opportunities, receive personal training, and acquire vocational skills through her Destiny Business Institute. In 2026, she founded Daughters of Destiny Interdenominational Fellowship, answering God's call to raise women as intercessors for families and nations. This fellowship has established prayer centers across Nigeria, the UK, and the US. Her teachings are practical, focusing on Christian living, family, and marital guidance, with a particular emphasis on women's roles. Apostle Busola is deeply involved in community evangelism, humanitarian activities, and prison ministry, including the rehabilitation of female ex-inmates. Her passion for supporting women over 40 led her to establish the 40 Plus Woman Investment Club, a platform for wealth creation and financial empowerment, alongside hosting conferences to address the unique needs of the age group. She is a sought-after speaker, author of several life-transforming books, and runs a weekly online transformation series on YouTube and Instagram called The 40 Plus Woman with Busola Jegede. Apostle Busola is happily married with children. With me, welcome Apostle Busola Jegede for her presentation. You're welcome, Ma. We're happy to have you, Ma.
Thank you very much. I greet everyone, and it's a joy to be here. I want to especially thank and celebrate Professor Dr. Merino for this awesome work, keeping it going and getting more people on board and more people inspired and educated in this awesome, silent phenomenon that is called trauma that we all need to understand. And it is my prayer that this work will continue to be established and will help more people in Jesus' name. So I am talking, of course, I'm a Christian, and so I'm coming from that faith-based perspective in talking about effectively managing trauma. And I've also been a student of jazz, and it was a totally life-transforming experience for me in that in my years of counseling women and running a women's ministry, which ultimately brings you into family and marital issues, because most women, that is the essence of what they go through. I've found out that the lens I had been using was not totally clear, but the trauma training gave me clarity and made my work more effective in counseling women and even men, and also in understanding some spiritual issues and putting them in the right perspective. So I'm going to be talking briefly about effectively managing trauma in faith-based circles. And what we would agree with is that emotional wellness is a topic that is fast gaining ground. It is fast gaining ground. Even in the church, we are having situations whereby we're inviting people to come and talk about emotional wellness. In our conferences, we're having breakout sessions where we invite those who are not really pastors, but who are practitioners in this field. And even though it's gaining ground, it's increasingly getting more popular, it is still highly guarded and it hasn't been widely embraced, because you get to a point where there is a clash. And that's what I found out, that most of us Christians, what happens to us, we get to a point where we seem to have a clash between, okay, this is what my faith is saying, and this is what this information, this education is saying. Does it make me less of a Christian? Does it make light of my belief? And I want you to know that when it comes to things like faith, these are things that we've been brought up with since we're young. Many of us, from when we're young, went to Sunday school, we grew up. So these are deeply entrenched things that is being challenged by knowledge. And the onus is on us now to be able to put this in the right perspective, so that we do not lose our spirituality, but we also embrace knowledge and embrace best practices, and because knowledge is also of God. And so emotional wellness, looking at it in that terms, we are going to find out that it is needed seriously, especially by those in the church, by those in faith-based circles. People in church are not exempt from different kinds of trauma that people experience in life. Yeah, even in the church, we are having cases of people who lose life, who lose life partners, loss of children, people are mourning, traumatic events, and even sometimes rape. Yeah, so many things that happen in the world out there happens also in church, because the church is embedded in the society. And so there is the need for a proper understanding of how to bring in this trauma care in a way that it will be embraced and in a way that people will get healing. So we have seen cases in the church of people who have suffered from acute trauma, chronic trauma, to complex trauma. In faith-based, even some people, even in the hands of so-called figures of faith, people have had stories, and even amongst people, even in the church, there could be issues of trauma that we have seen, and people are being traumatized even as we speak. As we speak, people are being traumatized, and there is such a culture of silence. There is such a culture of intimidation, what I would call spiritual intimidation. And so people are going through stuff, and they're in a place, in a particular setting for years, and there is this spiritualizing abuse. Yeah. Sometimes you're in a place where the abuse is spiritualized. And it is not only in Africa. There have been cases of people who run so-called cults, but they quote it with faith. And we know examples like in Nigeria, like the Jesu Igbo, and the one in America, Jim Jones, And these people go through these things for years, and nobody says anything. And there's so much spiritual intimidation that until after there's a major calamity, before people start coming out to say, this is what was happening in the church. This is what this person has been doing for years. And people don't talk. And so there is a need for us to enlighten people. And even moving from that, we will see that many people who counsel in the church, who are counselors, are not trained. And so people come into positions where they are not equipped, they're not effectively equipped. Yes, we thank God for the standard in the Word of God. There is the standard in the Word of God. But we've also got to know that there is the need for us to know that some of the scriptures have what is called cultural relativity. And so a particular scripture might have been written in the context of the culture at that time, or the situation as at that time. And when we are now in our present day world, we've got to find out how we bring in the balance of the word without losing the essence of it. We've got to bring in the weight of the word without losing the essence of it. And so when somebody is in a toxic marriage, when somebody is in a marriage that the person is being abused, I saw a clip. I was going to share the clip with Professor in one of the churches in the East. And the man was beating the woman. Meanwhile, they have 5 children. The woman was paying the house rent, paying the school fees, feeding them. And he kept on saying, she does not submit to me. She does not submit to me. And so that man obviously, and like a lot of men that we're going to see, is obviously a narcissist. And many people are going through things from their background which they are bringing, and they bring in the word of God to legitimize their wrong stance. And so when people are counseling people who, and I was actually looking at the pastor in question as they were talking, that, so what are you going to do about it? And what are you going to do? I'm going to say, and the woman was already saying something which is very, very important, which I want to bring out to every woman. And this is what a professor used to teach. Trauma that you don't deal with stays in the body. And I remember in one of our sessions, when she was teaching, when I took the course, she was talking about how cortisol is, the fight or flight mode, that some of us are constantly in that fight or flight mode. We are heightened throughout the day, throughout the week, for months, for years. And that what happens is that these hormones begin to damage our organs. And that's why you begin to, that woman in that clip said she was already having chest pain. She said it. And the pastor was sending her back and saying, in this place, we want to reconcile. But didn't even care about the health of that woman, because already the woman was so traumatized. The trauma had started taking a toll on her health. And people stay in such situations for so long that even before they come into contact with teachings like this, with information like this, a lot has gone wrong in people's body. And some develop cancer, they develop chronic diseases. And we can spiritualize it and say it's a witch, it's a wizard. No, it's coming from trauma. So we've got to know that when people are not trained, they may not give effective solutions, number one. Then number two, like one of the people who was giving a success story said, people can also suffer vicarious trauma if they don't know how to process this kind of trauma that they imbibe, even by listening to other people. So the first thing I'm going to advocate is that more church leaders need to be enlightened about trauma and to be trained. And I know that in church circles, many people do not like paying for training, because most of the time people go for conferences and the conferences are free. So if there can be a situation whereby snippets can be brought, for me, for instance, that I have purpose to support this cause. And as more opportunities open for me, I just recently got an appointment overseeing the Pentecostal churches in my province of over 1,000 churches. And so if I want to organize a conference, it is a needed topic that I'm going to put in, because now I'm overseeing pastors, not just women, because the Lord kind of repositioned my ministry. And so I would also have actually been talking to other people. Let's expose people to the importance of this. And then when they take they take a bit of it, then they can actually come for the training. I know now people are talking about emotional wellness. We invite people to talk about this thing, but now we are talking about training leaders to be able to recognize. One of the things that the training did for me was to help me to identify the root cause of marital problems. And so for a man who is always shouting, who is always saying the wife doesn't submit, I found out that a lot of men have had serious childhood trauma, and so it's not treated, and they bring it to their marriage. And so some people, there's a particular case, I'm so sure that this man grew up in a very authoritarian family, that the father was always the lord of the manor, shouting on everybody. And so that's the kind of stance that he has. And now, if church leaders are not trained about trauma, there will be many people that will continue to suffer in their churches, and even they themselves might have gone through trauma that they need to process, and they will bring it to bear on their congregation. And so this particular man, the danger that I see in Christian circles, talking about this person who has gone through chronic childhood trauma, who doesn't believe that does not believe a woman should be in a leadership position, because that's the way the father, suppressed the mother, and that's all he knew. And the danger is this: when people have this warped and traumatized childhood, they will find a doctrine that supports it. And so this gentleman keeps on posting on social media, a woman should not lead in the church, a woman should not do this, a woman should not, and in fact, it came straight at me. and instead of fighting him, I could just see, where is he coming from? Why is he? Actually, in the Bible, there was Deborah. Deborah led men to war. It's written in the scriptures. And so it is very, very important. Otherwise, people begin to turn to doctrine, their experiences, because they can just find a scripture that supports it. And so people taking a position backed up by doctrine, but triggered by trauma. People take a position which can be backed up by doctrine, That's why people will bring a word, submit, 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 until the woman develops cancer right in that marriage. The man is not taking care of her and she dies. They'll keep on bringing the doctrine, 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 but it's actually triggered by trauma that they have gone through and they are not ready to change their ways. So it's very, very important for church leaders to be enlightened, to be trained, so they treat their own trauma and they are able to identify trauma in their members and generally to give people wholesome healing. So let's train more pastors about trauma care. Next, the issue, this is the next thing, the next area for us to effectively manage trauma in the church or in a faith-based environment. Deploying the skills to help people. This is one area where I face the brick wall. So I set up my trauma clinic on Fridays, but I do counseling on Wednesdays. And from the counseling, I could identify people that needed trauma care. And so when we started, I could see a lot of people kept on bringing their children, because they'll say, my son is not talking, he doesn't talk. And by the time we go through sessions, therapy sessions with these children, they begin to open up. But this is where I found out that apart from those children who are open to come for therapy, a lot of women, a lot of men prefer to pray instead of seeing a therapist. They prefer you pray, please just pray for me. Pray for me. Because people still have this thing about mental health issues. If I have to say a therapist, then that means it's saying that maybe I'm mad or something. So there's still this stigma. So I found out that a lot of people don't want to come forward for therapy sessions, but they prefer to come for counseling and prayers, and we even want you to continue to do deliverance. And I told a particular lady, I said, look, you need serious, what you're going through, we need to know the root cause so that we deal with it. It's not prayers you need. You don't need prayers. You need to process some things that you have passed through in life. So typically people prefer to pray. And I'm not talking about the pastor now telling them to pray. They prefer to pray rather than come forward for therapy sessions. And the next thing is, because the church is a free environment where you get free service, people counsel you for free, people pray for you for free, they don't want to pay for the therapy sessions. So it's I think when I was setting up my clinic then, this was a major issue. They don't want to pay. And even when you set a time, like professionally you want to do it, I'm going to talk to you for 45 minutes, go straight to the point. So they still expect you to have that pastor's compassion. So it's a tall order wearing both caps. So maybe I'll still talk to the professor. How to effectively wear those two caps. I'm a pastor and I'm a therapist. It is one of the areas we need to look at to have a solution, because people have not yet fully embraced the idea of seeing a therapist, as they often feel they can work out their problems themselves. So therapy makes people accountable, whilst prayers passes the buck to God. Because in therapy, you will give them things to work on. You will tell them you need to do this. So, but with prayers, it passes the buck to God. God will do it. God do it. God do this. God do that. So people prefer that. So I'm suggesting that more seminars and programs are needed to enlighten people about trauma and trauma care. Many more churches should organize this kind of trainings and invite professionals. What do we find? What do we find now? Many churches would organize burial programs, but we do not see a structured grief counseling system. Yes, they will do service of songs, do the burial, deploy the choir, but they do not pass these people through a grief counseling. As a matter of fact, I was particularly alarmed when a particular denomination in our nation had series of deaths, major deaths. The founder died, the wives died, but there was no structured grief counseling. And people just move on. And these things, there is no way you're going to see the gap. It may take a year, it may take 2 years. You're going to see an aspect of the lives of these people, and there will be a gap because there is no a closure for a lot of things. So we want to see the areas whereby the things we do in faith-based circles, we can integrate some of the things that we do in therapy sessions, like grief counseling. Also, many marriage counselors need to be trained to recognize a person who needs a session on anger management. You know, a session that would address the root cause. I'd say talk therapy. And people say, I don't want people to know my problem. I don't want people to talk about my problem. Yes, there's got to be confidentiality, but people have to open up. Effectively detecting somebody who has had childhood trauma is necessary because many relieve their childhood traumas in dreams. Watch this. And as I bring this to a close, because we're talking about spirituality. Many pastors, including myself, we've written books about dreams. But one of the things I was doing a study on trauma and dreams. I was looking at some papers that were presented because of the shortness of time. I couldn't integrate them. And there are several studies that have been done by professional psychologists that could see that some of those dreams that we interpret, I say this guardedly because I'm also a woman of prayer. It is not all the dreams Joseph dreamt, and it was a signal from God. Those dreams, strategic dreams, divinely inspired dreams, they do exist. But you see, there are some dreams that is a relieving of trauma. And when people have such dreams and they come out, I dreamt I was writing an exam. That person had serious trauma during the school. And the person is relieving the trauma. And we don't interpret it effectively because we don't have such trainings. So it's important for us to know so that we can guide people. There are certain dreams, they are not spiritual in any way. It's just a trauma being relieved through the dreams. And so there is so much to say. We do not diminish the importance of prayers and faith. I do not diminish the importance. These are pillars of our being, of our faith. And I'm a strong advocate of prayers. I'm a woman of prayer, and prayer works and it will continue to work. However, more needs to be done for people who have suffered trauma within the church, so they do not continue to suffer in silence, because a lot of people have PTSD and we spiritualize it. Thank you so much for this opportunity. Thank you so much. And I pray we'll be able to do more in our churches.
You didn't come to play, man. I have to come up the stage. I'm like, you could see me just typing and typing. Thank you so much. That was absolutely amazing. Thank you for your transparency. Thank you for speaking truth to power. Thank you for advocating for the people that who need help the most. Everything you have said today. Bam, 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 bam. Thank you so much. We appreciate you.
You're welcome. You're welcome.
Bye-bye.
Bye.
Okay, Esther, you can come back up. I just needed to come up and say thank you to her.
Okay, ma. Thank you so much, Apostle Busola. I just wanted to say, well, I think Professor Marino, I said what I had in mind. So I was going to say that faith really, as much as we say is the bedrock of it, of families, it's part of the key things we emphasize so much in Africa. We need to do it right. So thank you so much, Apostle Busola. That was very, very, very insightful and a powerful session. We are right now moving to the next session titled Mental Health Within the Nigerian School Systems by Mrs. Yinka Ogunde. Mrs. Yinka Ogunde began a career in marketing communication as an advertising practitioner before transitioning to the education sector, where she has led several transformative initiatives. She's the founder of major projects such as the Total School Support Seminar Exhibition, one of Africa's largest education events, and the We Are the Future of Our Nation initiative. She also launched School Tips magazine. As CEO of EduMac, she created the Concerned Parents and Educators Initiative, Nigeria's largest education-focused online group excuse me, with nearly 240,000 members and chapters nationwide. Mrs. Yinka Ogunde is a certified coach, trainer, and speaker with the John Maxwell team, with extensive experience training leaders and teams across Nigeria. She also founded the Become More Tribe and Kingdom Business Women Group. Welcome with me for our presentation, Mrs. Yinka Ogunde.
Thank you for that introduction. And I must say, it's a pleasure to be here with you today. And thank you, Professor Merino, for the awesome job that you are doing. Even just listening to Apostle that spoke earlier, it was very, very instructive. And it's really going to lead us to the discussion that we're going to have in the next few minutes. And of course, I will be looking at our educational institutions and how trauma affects us, and what are the things that we even have in place to manage trauma. So once again, thank you. If somebody can share my slide, I will be very grateful. I will appreciate that. And I'm sure that in the course of this conversation, a lot of definitions will have been made concerning drama, what it is or what it is not. How do we know that this is a traumatizing event, and so many other things. So I won't belabor you very much on the definition, but in order to lay a background, the first thing I will say is that it is a psychological response to a highly distressing or disturbing event that overwhelms an individual's ability to cope. A highly distressing or disturbing event that overwhelms an individual's ability to cope. That word, being able to cope, is something that's become very, very relevant in the context of our part of the country, our part of the world, and what is going on within our environment. The things that are going on in our environment is not in our schools, it's not separate from what we have in our environment. It's not separate from what we see in our churches. It's not separate from what we see in our homes. And that's why today I will try to break it down as I go along, as it relates to the education community. Trauma can result from a wide range of experiences: physical abuse, emotional abuse, accidents, natural disaster, poverty, unhealthy working environment, and so on and so forth. As I was going through this, one of the things that occurred to me is that there is none of this that is not present in our educational institutions. There is none that we don't see. Every day we hear the news. Is it from physical abuse that we want to talk about? That I think within the last 24 hours or so, there's a particular video that people have sent to me showing the body of a boy that was, I think, is it 162 canes, or he was told to do something for 162 times by a teacher in Ogun State. And unfortunately, the boy lost his life. What did he do? They got something in the classroom, and maybe in the moment of play, the boy hits that thing and it got broken. This is an incident in a school that resulted in death. You can imagine the trauma on his classmates. You can imagine the trauma on the teachers in that school. You can imagine the trauma on everybody around, because if they don't deal with it, it's going to stay with them throughout life. Emotional abuse. We see the children in our schools. We see their relationship with the teachers, their relationship with even their parents, and the huge emotional baggage they bring into schools. Accidents, of course, they occur. And let me go on because of our time. And next slide will show you that the education community consists of various units that I will talk about briefly today. We have the teachers, we have the students, we have the parents, we have school management, we have the non-teaching staff. We have so many people within an educational institution. So you can imagine what happens when all these people come together in a place. You can imagine the emotional baggage some are bringing in. You can imagine the convergence of various experiences in the school. And that's why talking about trauma within the education institute, within the education community, it becomes very, very important. It becomes something that we cannot push aside because it is difficult for learning to take place if all this has not been dealt with. Let us start with the teachers. A few days ago, there was a viral video showing a hefty male parent beating a small frame teacher. You could see other teachers trying to get hold of that aggressive parent. And every one of us, we watched in dismay as the parents moved about, looking very menacing. And you could actually see in that video one little girl who put her hands on her head and was almost like saying, "What is this?" What has brought this about? Yes, I have the full story because I've spoken to the school owner a couple of times. But what will and it was nothing to warrant a full grown-up man beating up a teacher. And one thing I can tell you is that it is not a strange occurrence within our schools. It is not a strange occurrence in the classroom. We hear of parents that will go into a class and actually slap a teacher. And I know that parents are not, in some schools, parents are not allowed in classrooms, but you will see these parents, they will barge in their way in order to deal with the teacher because of a perceived incident that happened to their child. And sometimes those things are never true. Those things are never true. There was a particular one that was a bit traumatic because the teacher actually collapsed. This one happened about 3 weeks ago, and the parents actually came back from her house to beat up the teacher. And it's not only the teacher. You can imagine it can also be vice versa. Teachers beating up students, students slapping teacher, students laying sexual traps for teachers in order to deal with a female teacher. We have so many of that in education in our schools. These are real life issues. These are cases that come up regularly. These are cases that educational institutions have to deal with. But unfortunately, which I will also be talking about briefly as we go on, you will see that there is no structure in place. There is nothing in place to be able to handle that. Sometimes schools will have maybe a counseling unit, but the counselor will not only have to deal with that unit, he or she may be given about 2 or 3 additional classes to handle. And in the process, the whole essence of being a counselor is lost. The whole essence of handling that department is lost because it's taken very casually within our schools. So let me go on. What happens when a teacher is traumatized? What happens when a teacher goes through that experience? What happens when a teacher has to live through the fear of being beaten, the fear of being sacked, the fear of losing the job? I mean, a lot of things. The teacher cannot give his or her best. The teacher cannot deliver value. The teacher cannot think in terms of the students that is in his or her care. He or she will experience high level of stress and anxiety and fear. And of course, when you look at the situation whereby the society doesn't perceive them as people who have a lot of worth. I say that with all due respect, but I have seen a lot. When people speak about those in the teaching profession, especially in this part of the world, they assume that of course, they're badly paid, badly trained, low quality, and we use so many uncomplimentary words about them. The question that comes to mind, these are the people bringing up our future generation, and we are not concerned about their state. A teacher that is undergoing that will not be able to give his or her best. And you can be sure that the children will be the one that will pay for this. Of course, I cited the real life story where the teacher had to be revived after the parents had beaten her. And unfortunately, this was not reported to the police. Unfortunately, the parent might get away with it. And so many parents do that. This is a practice that I hope the government will take very, very seriously, and educational associations will also take up such matters. Because sometimes when the parents have so many children in the school will just find a way of appeasing the teachers and let bygones to be bygones. Meanwhile, a physical abuse has taken place. Emotional damage has been done. So, the teacher that is put like this straight into the classroom, certainly that teacher cannot concentrate. He or she cannot make the right decisions and will not be able to effectively manage the class. That is a point of emphasis for me because I have seen it happen so many times. I have seen traumatized teachers. I have seen teachers who have gone through so much that all they are praying for is a way out of the profession. All they are hoping is that something will happen that will take them away from the teaching profession and put them in another place. That is the effect that trauma brings. Other issues that causes trauma in teachers, I said, of course, the poor salary structure, toxic work environment, that is very real in some institutions. And of course, sometimes the unpleasant home environment. This goes with the fact that when they are poorly paid, they cannot take care of themselves. They cannot do the things that they're supposed to do. They cannot take care of their family. And the whole family setup is turned upside down. So how can they be helped? Teachers can be helped through therapy. We must never assume that all is going on well. They must be fortified enough to cope. Teaching is not an easy job. One of the things you will notice in my presentation is that I've spent the last few minutes talking about teachers because I know the importance of teachers in any institution. The head of the school, the principal, or the school owner, there is a limit to what he or she can do. It is the teachers that stand in front of the children and engage their class and impart knowledge. But if the teacher is not in that right frame of mind, if the teacher is not able to cope, the children will be shortchanged. And that is why we are raising so many students within our society, within our environment, that the only thing they are trained to do is to pass, is to, I don't want to, I'm trying to avoid using the word to cheat in exams in order to get the certificates. But when a teacher is emotionally stable, when a teacher is happy, when a teacher is thriving, you're excited. You want to talk about your subject. You want to ensure you carry the students along. That is what I believe, that having the right structure in place in terms of therapy will be of utmost benefit to our institutions. Let me go on to talk about the students. We are living through very, very challenging times, and the education sector globally is coming to terms that we have a generation that needs a lot of mental support. The reality that we have in our schools is that you name the vice, and we will assure you that those are some of the issues that are coming up daily. The first, apostle, when she was talking about rape even occurring in some faith-based institutions and things like that. That is something that people deal with in schools a lot. We are talking about critical things that the students in our care have gone through or are going through. There was a program about 2 years ago. I think it was during the Girls' Day. And there was I think students of the school, they organized like a session with the students, and they were all there. They were about to close, and this tiny girl in GSS1 asked a question after they've talked about rape, after they've talked about abuse, after they've talked about so many things, and she asked a simple question: that what if the person that is doing all these things that you have talked about is in your house? Of course, immediately that set up a red flag. Even though they were able to answer the question in there some sort, the school knew that they had to intervene. They called the parent of the child, and immediately they called the parent of that child. He knew what they were calling him for, and before they knew it, because he was a very, very highly placed person, he accused the PE teacher of being the one that perpetrated the act on his daughter. This is a real life case that I'm talking to you about. Even if you go to our Facebook and see some of the things that we wrote about 2 or 3 years ago, because we had to rise up to fight on behalf of that teacher. Would you believe that it was a case that somehow got muddled up? The man had been abusing his daughters for years. His wife actually ran away from the house and left the 2 girls. The state had to come in. Thank God it's a Lagos state, and Lagos state always respond very quickly to such things at times. And they did. They had to rescue those girls. In fact, it was an operation because he was about to escape with those girls again when he found out. The CPE group that I run had to be in court in order to be able to show that truly this is a man that deserves to be behind bars. You can imagine a child that has been subjected to that. What will that child learn in the school? What are the things that is going on in their minds when they sit in the classrooms? And that's why that trained therapist becomes very, very important in the educational environment, especially in a society whereby the schools are now are now having to take on parental roles. Parents are sometimes very, very busy trying to make ends meet, and every other thing is given over to the school to do. And our schools are not equipped to handle that. Uh, what are the things that we can do for the student? Please, the key thing, I hope Professor Marino will consider this. Make therapy more accessible and affordable so that parents who want to undertake that or educational institutions that want to sign on, they will be able to do that. Another thing is the schools must find a way of creating support groups in institutions. They must find a way of creating support groups so that people do not feel isolated, especially amongst their teachers. So they do not feel they are alone. They must create a community. They must create a culture. They must create a place where people will feel safe, where they will feel heard, where they will feel that they matter. That will be the beginning for our institutions. Those are areas that we must all look at. The culture that we have within that educational institution, does it promote a communal feeling? Does it promote a place where everyone believe that they are safe, where the students believe they're safe, where the teachers believe they're safe, and even the entire education community, both the non-teaching, both the teaching staff? I believe my time is almost done. So I said there must also be a strong advocacy for self-care practices within our schools. We have to be deliberate about that. We have to be intentional. We have to ensure that we help those in the education group to know the importance of what they're doing and to know that you cannot give much if you do not take care of yourself. A sick body cannot take care of others easily, even though trauma may be something that we cannot see, but inside it is eating you. You must find a way of creating a place where you will be able to onboarding and take care of yourself in order to be able to do it effectively. And one of the things I also put in my slide that it is, we need the government to be more intentional about trauma care services, especially in schools. A large part of what I have talked to you about, they happen in private institutions, but in government, it is at a higher level. It is worse. The government must find a way of understanding the need for this and not just dismiss it. You know, sometimes when we talk about trauma, when we talk about all these things, there's a way people dismiss it. I think the last speaker also said something like that people actually think that I'm normal now. I'm not a mental case. I don't, they shouldn't take me to Aru or anything like that. That is not it. That is where the advocacy comes in. That is why we must get people to know that when something happens, you cannot deal with it on your own. Talking to people will help. Reaching out will help. Going for therapy to be able to find the root cause of it and deal with it and process it becomes very, very, very important. So it's okay to feel unstable. As I close, I always tell myself that it's okay to dissociate. It's okay to hide from the world. It's okay to need help. It's okay not to be okay. It is not a personal failure. When you are not okay, when you feel unstable, when you feel you are not connected to anything happening around you, when you want to hide from the world, when you know it within yourself that you need help, I can assure you it's okay not to be okay. And it is not a personal failure of yours. So I hope that within this few minutes I've sort of tried to capture with special focus on teachers and what they're going through or what is happening within the within our schools, the need to keep them emotionally stable. They need to give them that reassurance so that they can cope and raise the new generation of Nigerians, the new generations of Africans that we hope for. We need to deal with that, and we need to acknowledge even what our children are going through in their homes, amongst their peers, and in the world that we live in, a world that is confusing even to adults. And sometimes you just feel that, hey, all the rules that I learned yesterday, they no longer apply. Always remember that you can be helped. Thank you very much, ladies and gentlemen. It's been a pleasure to be here with you. Thank you, Professor Marino, for inviting me. And I
Oh
hope,
my goodness. Thank you so much. I don't know if you can hear me. Can you hear me?
yes, I can hear you. I
Yes.
can hear you very.
Oh, that was so powerful. Thank you, thank you, thank you. I mean, you went there, you gave us the deconstructed portions of it in the Nigerian school systems, and any school systems across the globe can actually get from what you're saying. Thank you for sharing the stories. And there's no better person to have this conversation. Thank you for giving us your time today. It was amazing.
Thank you
Thank
very
you.
much, Prof. Thank you. A pleasure for me. Thank you.
Oh, wow. We have been blessed. We have been blessed.
Yeah.
Esther, you can come up.
Okay, thank you so much, Mrs. Yinka Ogunde, for that presentation. And truly, while she was talking, it's very true that when we come to schools, we're talking about mental health in schools, we tend to focus more on the students. And when we focus on the students, we tend to focus more on the aspect of bullying in schools. And we're forgetting the teachers, we're forgetting the school owners, we're forgetting the parents that are sending the children to school. And I mean, this was really an eye opener. Thank you so much, ma'am. Our children, they say, are the future and the place they spend most of their time in the schools. So, yes, we agree with you that we have to make trauma care a part of the system so that we have more whole people produced from the educational system. Thank you once again, Mrs. Ogunde. Next, we have Dr. Adedotun Ajiboye speaking on the topic disengaging from intergenerational trauma through trauma-informed care. And I'm going to read her bio. Dr. Adedotun Ajiboye is a PhD student in clinical psychology. I'm very sorry, he's a he. I'm going to be reading his bio. I'm very sorry about that. Dr. Adedotun Ajiboye is a PhD student in clinical psychology. He is a licensed clinical psychologist at Ekiti State University, teaching hospital Ado Ekiti. Apart from his clinical psychology career, he obtained MSc in social development and health from Queen Margaret University, UK. Furthermore, he is an experienced counselor and has been involved in training other counselors who serve as service providers at grassroots levels. He has authored books on drug abuse, one, Ways Out of Substance Abuse, a self-help guide. Number two, Overcoming Substance Addiction, guide for parents and educators. He operates as a mental wellness coach on Dove television and other media outfits. More so in RCCG Junior Church at national and continental levels. He had facilitated training on one, drug abuse prevention and basic counseling skills. He presently coordinates a mental health focused NGO, which is called the Hope Initiatives for Mental Health Wellness Anti-Drug Society. In addition, he pastors in the Redeemed Christian Church of God. With me, welcome Dr. Ajiboye. You have the stage now, sir. Thank you for coming to be with us today.
Thank you. Thank you very much. Thank you, everybody. Thank God for another African Trauma Care Conference. I want to appreciate Professor Merino for this highly needed conference for all of us in Africa and all over the world. Is an aspect of our health that we cannot overlook at all. Somebody may lose his leg, at the same time can still be the president of his country. But if we lose our mind, or we are challenged, we are traumatized, that may affect us in so many ways if you don't take care. So this thing is really coming in a time whereby African is facing a lot of challenges. So I really want to appreciate Prof for bringing this on board and all your teams. I will just mention Mrs. Adebimpe. She has really been on our next as speakers, following us up so that we can be up to date and do things rightly. Thank you for the fantastic team that you have. And for all the audience, my topic, as you have seen on the screen, is disengaging Africans from intergenerational trauma through trauma-informed care. And if you look at this topic, you discover that all we have been talking about this morning, opposed to Mrs. Ogunde, the experiences that were shared by some of the alumni of Jazz Education Institute, and what also Prof shared initially, has origin from this, what we are passing through in our country or in Africa as a whole. That's what we call intergenerational trauma. So the main reason why we are going into this topic is that this has impacted negatively on African people. That is intergenerational trauma. It has impacted in our in individuals' lives, families, workplace, politics, profession, and nation, and in different fora. And another reason why this topic is necessary at this time is that what can you and I do to mitigate this intergenerational trauma? Because if we are handling the problems in the schools, the problems at the home front, the problems in the workplace, and we are still having this intergenerational trauma within us, one may not be able to excel as expected. There was somebody that I met on a program recently. He's a prof in the United Kingdom. He's from Ekiti State. And when he was talking to us on a platform, he said he owned a university in the United Kingdom. I was looking, yes, he was a black man. So I was saying that this is unique. Is it really true? But when he was explaining how those things manifested, I discovered that he was able to delete the intergenerational trauma. And that made him not to just be a support worker in the United Kingdom. He owned a university. A lot of things have been passed down. Like if you look at the definition of intergenerational trauma, it is an historic traumatic event that is being passed from one generation to another generation. What are these historic traumatic events? When you talk about the slave trade, you talk about the apartheid, you talk about genocide, the one that happened in Rwanda, the colonization. Most of the countries in Africa were colonized. Then all these things is being passed to us. And one way or the other, sorry to use this concept, the slavery mentality, the having a kind of thought that I'm not up to them, inferiority feelings, and thought like there's war around me, I need to be very careful. Suspiciousness is affecting us in our present age. It can affect an individual, it can affect us in our homes because of those intergenerational trauma. For example, if you have this slavery or this thought that I'm not up to them, I don't have the capacity, and you brought that mentality into your workplace or into your home, it will affect so many things. So it is high time for we Africans to delete this intergenerational, transgenerational trauma so that we can explore. I just mentioned an African in the United Kingdom who owns a university. He did that because he was able to, separate himself from the thought of I'm not up to them, I cannot be this. This is the type of job I can get in this part of the world. I may not be able to do this one because I'm coming from Africa. And this brings a lot of trauma. And you just see yourself not exploring your potential as you should. And this can affect us mentally. It can lead to anxiety, can lead to depression, it can lead to a lot of things like that. Now, but to mitigate this, that is why we are really appreciating Jazz Institute for allowing the whole world to understand that we need to inculcate trauma-informed care into our settings. Now, we have heard from the short setting from schools, from homes, and in workplaces, so that all these intergenerational, transgenerational trauma that we have, then we'll be able to deal with them and overcome them. Now, how can we understand this intergenerational trauma in African context? I'm going to be looking at that from two perspectives. One, the historical sources of trauma, and two, the mechanism of transmission. Now, what are those historical sources of trauma in Africa? Africa's traumatic history includes colonial exploitation, the transatlantic slave trade, apartheid, genocide, as we've seen in Rwanda and Darfur, the civil wars in countries like Liberia, Sierra Leone, and Sudan. And it has been confirmed also by researchers. I think if you see my slide, you can see some researches have been done on that these trauma are extended to post-colonial era. So the struggle we face during the slave trade, through the colonial era, is also still with us at this present time, thereby affecting our politics, affecting our homes, affecting our disposition, affecting our involvement, affecting our exploration, even in the social setting. And somebody said, the moment you don't undo this, then it brings a lot of emotional wounds. As you can see on my slide, Daniela 1998 was trying to say something like that intergenerational drama that is not dealt with will bring about a lot of maladaptive coping mechanisms in the future. Now, another aspect, apart from the historical background, is the mechanism of transmission. How can this transgenerational trauma be transferred? Now, first of all, through family or maybe genetics. Okay, and a lot of work has been done by, for example, Yoda et al. 2016 show that psychological symptoms of trauma, such as depression, anxiety, PTSD, are often mirrored in children. So if a father is having this transgenerational trauma, there's possibility to be transferred to the children. Some people will just have this mentality, when you finish university, you become a civil servant. But there's nothing that says so. Somebody that finished university. In fact, the parents will even be planning to get job for him after they retire in the same office because they believe that he should go in that pattern. But this person that is coming up, who is their child, has potential to be an entrepreneur, to be an entrepreneur in his lifetime. But it's been, there's a kind of a link from the parents to him that a job is waiting for you in the civil service. So we need to really explore and understand ourselves from the inside. And at the same time, delete the intergenerational trauma so that we'll be able to fulfill purpose, we'll be able to affect our generation beyond what we are doing right now. Then number two, there are cultural narratives apart from the family dynamics. The society you find yourself, where you grow up, what they are saying there. One way or the other, there's a theory in psychology that talk about social learning theory. What is going on around you, you begin to imitate it, you begin to go along with it because you are born into it, people around you are doing it, and you think that is the normal norm, so you also should do it. Then we should also separate ourselves from some of the cultural narratives that is not really our real self. Okay? Then another thing is stereotype gender roles. There are some gender issues that are being passed from one generation to another. And I think a lot of NGOs are doing a lot of things now about female genital mutilation. People are crying against that. But, there's still some people that are still doing it up to now. And female genital mutilation bring a lot of trauma. So Africans, we need to, delete, or permit me to say, format our mind from some of these stereotypic culture that is impacting negatively on our mental health or bringing trauma into our lives. Then there's this mentality that the domestic chores should be done by a girl, and it's just the responsibility of a girl to wash plates, to cook in the house. And in the process, when that child gets married, when that daughter gets married, she will put all the work in the house on herself. And she will be so stressed, confused, and can have depression. And boys, with the mentality that boys are just to wash cars, boys are not to be involved, you are to stay with daddy, watch television, and allow the girls to work at home. The moment we don't delete or format our mind from such mentality, it will be affecting our homes. Because when you don't help your wife in the domestic chores, that woman will be overlabored and that will be stressed. If you are not able to support in some household chores, that also will be affected. So if you want to have to address traumatic issues in our home, we need to also delete some mentality. Even in our schools, recently we discovered that we talk more to our girls and we neglect our boys. In that discussion, we're able to raise that time that we should not just talk to our girls, we should talk to our boys. The boys also should understand what they should do. If we say the boys are raping girls, have we educated them? Have we spoken to them? Have we allowed them to understand their inbuilt capability? Do they really know what it is to be a man? Okay, is it, or they are just getting the transgenerational mentality of becoming a man? So all those things we have to put them into consideration as we are trying to overcome trauma in our generation. Then this socio-economic system, I think I've mentioned something about this, that I'm just a civil servant person because my father has been a civil servant for 30 years. And even he's telling me that when he leaves the workplace, I'm going to also occupy that position. Whereas this person is very innovative. If the person is able to understand his personality, It can be an inventor. It can be an inventor that will bring Africa to the global perspective. People that invented aeroplane, people that invented all these things, they are human beings. And if you have schooled in Western world before, I'm sure some people on this platform have schooled there, you discover that Africans are endowed. Americans are endowed. Everybody is endowed. As God said, He said, everything that He created is good. It's very good. So Africans, we are very good. We are created wonderfully. We are fearfully and wonderfully. We are not second citizen. Okay, so we should not have this intergenerational trauma affecting us, limiting us, disalign us to fulfill purpose and affect our generation. And one thing is that since your inner self recognizes that these are the potentials you have, and when you now get to the age of 60 and you discover that you have not explored that potential because of the intergenerational trauma, at that age 60, that's why you see some people when they are retiring, they discover that I've not really fulfilled purpose. I've not done what I'm supposed to have done. And that can lead to anxiety disorder. That can lead to depression. It can even lead to psychosis. So all these things, we need to put them into consideration. And I'm sure somebody must have talked about trauma-informed care, but I will just go through this principle in a few minutes so that, because I believe that professionals are on this platform, so that we can see what we can do to help Africans to overcoming transgenerational trauma. Now, safety. As a professional, as a trauma coach, as a mental health professional, we must make sure that we create a very conducive, secure place for people to share their mind. If you say people should express their mind in our workplaces, do we have a space for that? Is there confidentiality? Are we sure of confidentiality? If we want students in schools to come and share their mind, are they safe? Is there confidentiality? So in Africa's setting, we must create that safe space. In the church, if somebody brought his traumatic experience to you, hope that will not be heard by other people. So there must be a creation of safe space so that people can share their traumatic experience and be able to delete their mind from this transgenerational trauma. Then there should be trustworthiness and transparency. And we should also, because we were in a conference recently, we discovered in my home field as a clinical psychologist, we discovered that we are just over 500 clinical psychology serving almost 300 million Nigerians. That is very minimal. So that's what we are doing, what Jazz Institute is doing to be able to expand the course so that at least in school, in our schools, in our churches, you'll be able to have a kind of psychological first aid even before they refer you to see the professional, so that there will be peer educators, peer empowerment, so that people can overcome their traumatic experience. That there should be collaboration. I think what we are doing here is collaboration, so that people will be able to do a lot when you relate with others. Then we should be able to recognize what are those historical and gender issues that we need to deal with as we are taking people through therapy. Now, as I close, now we need to consciously, individually, as families, disengage our mind from this transgenerational trauma. Either transferred, either because you are born in a community, these inferiority feelings, I just want to have money, whatever job I do. I've met somebody before who was one of these countries and was complaining every day. Within myself, I was saying, but nobody forced you to be here. Why this complaint? I should have done this if I'm there. I should have done this if I'm in Africa. I should have done this. Please understand what I'm trying to say. I'm not saying we shouldn't travel out of our country. But when you are traveling out, travel with the sense that you are fearfully and wonderfully made. You are contributing positively to your environment. Look at what Professor Merino is doing. He's promoting African culture. He's promoting African capability in the Western world. He's showing the Western world that we have the grace, we have the ability to be able to affect our world positively. So let's try to delete and format our mind from all this colonial era, slave trade mentality, war, our country is not safe, the environment is not safe, so we need to be suspicious, we don't need to relate with others. Let's delete all that and pick up our reserve so that we can affect our generation for good. Thank you very much, and God bless you.
Well done, well done. Thank you so much. Thank you so much, Doctor. So thank you for gracing us with your presence. Thank you for the powerful, powerful presentation. Look, intergeneration, and I love the way you took the macro, you know, the systems, and then you brought it back down to us as individuals. Thank you for that, because they're all intersections of pain. And we cannot just look at the individual. We have to look at all these other factors stemming from the neocolonization. So thank you. And we really appreciate you spending time with us today. Have a good one. All right. I invite the MCs back.
Okay. Thank you, Dr. Ajiboye. Thank you for that insightful presentation. Truly, truly, intergenerational traumas are mirrored in our children. So it's like it's from one generation to the other and to the other. It is time for us to take action, and it is time for us to all rise up and be a part of what we're doing here at Jazz Education. Yeah. Esther, is it time for our Zumba, our stretches?
Yes, it is. Sorry, I was muted. I didn't know that.
Okay. So it is time for a short break. But just before then, we will spend some time doing some stretches and Zumba. So if you're ready, you need to see where Dr. Merino is doing her Zumba. It like gives me so much joy. And I told her that I'm very inspired. I need to join the Zumba class. So we're going to be doing that today. I don't know.
Okay.
Yeah.
Now I'm going to lead this. I'm going to lead this. Esther, I'm going to lead the Zumba. All right.
Interesting.
What do you say?
I said interesting.
Yes,
I'm ready.
they said I need to remove background so that we can look, because where are my people? Where are my people joining me? Everybody get ready. We're going to Zumba. Everybody, everybody get ready. We're going to Zumba. And so every stretch, you're going to get up. We have just 5 minutes to do this. And we're going to do it without music. So because we really want to look at the stretches. And they remove the background so you can see, so my people can join me. No, just go to settings and just go to that one. There you go. There you go. All right. We're Zumba. We're Zumba, Zumba, Zumba. Is everybody ready? Let's get up. Let's get up. And part of what we do when we're talking about the 5 fundamentals, part of the 5 fundamentals is that you move. It's movement. Ire, are you here? Where's my niece? Come, Ire. We're going to Zumba. So I want us to just kind of, first of all, I want you to just move your neck clockwise 3 times. All right. And then we're going to go the other way. Okay. Are we good? Then you go up and down. Big Bill, where are you? I'm here. Okay. All right. Now we're going to drop your shoulders. So breathe in and out. Do it again. In, out.
Why are you calling me?
We're doing Zumba. You want to join us?
No.
In. That's my niece. In, out. All right. So I want you to kind of shake anything that you can shake. All right. We're just going to shake our bodies. Everybody shake your body. Shake your body. Shake, 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 shake. Shake your legs. Shake your legs. Move it. Move it. Shake your legs. Shake your legs. Shake your arms. Move your arms up and down. Up and down. So we're going to do this one with the arms. Okay? You're going to go like this. And let's see how long you can hold this. We're going to count to 20. Don't drop anything. So you go 1, 2. You can do 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now stretch it out. We're just doing stretches, Zumba stretches. Stretch it out. Stretch it out. The other arm. All right, so now we're going to jump up and down. You ready? All right, we're going to go 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Okay, we're gonna add one what is it? A kick to it. So you're gonna go 1, 2, kick, kick, 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 1, 2. Don't be tired. Kick, 1, 2, kick, kick. All right, take a deep breath. Another one. Because we're not using music today, we're gonna just do it with music in our hearts, okay? All right, this one you're going to jog in place, okay? We're gonna start slow. Then now, go, 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 come on, 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 all right, take a deep breath. Another one. You can do this to stable yourself. I don't know if you can see me. Let me show you. That's what we're doing. You can do that, or you can just hold it. And then we'll do the other one. Stabilize yourself, get your balance. Get your balance. We're good. And try to touch your toes. Do it again. Okay, we're gonna go up. Take this arm, try to touch your back, and then pull it backwards. Pull it backwards. Then we're going to do the same thing. Just stretch, 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 stretch. You can feel it. Stretching is good for you. You know, make sure you stretch your muscles. You stretch yourself in the morning, at night, anytime you have a minute, you can stretch. When you get up from your desk, make sure you stretch your back. You know, make sure that you just allow the blood to circulate. All right, are you ready? One more thing. All right. We're just gonna close our eyes. And breathe in through your nostrils for 5 seconds. You're gonna hold it for 6 seconds. And you're gonna exhale like you're blowing into a balloon for 8 seconds. All right? We'll do it one more time. All right. Thank you for joining me. I hope you joined me. I hope you joined me. Did you, was it 5 minutes or did we go over?
We used 6, but we're still good.
Okay, we were right on time then. All right.
Thank you very much, ma'am. That was so refreshing. So we have 4 minutes left in our break. You need to grab some water. You need to go walk around and come back to your seat. You need to pick somebody. You need to make a quick call. Do that, and in 4 minutes, we'll be back to continue the conference. See you in 4 minutes. Okay, 4 minutes is done. We hope you are back now, everyone. If you're here, say yes, yes in the chat box. I don't see our comments yet. If you're back, say yes, yes.
Hey, Esther, this your yes,
Yes,
yes
ma'am.
self. It's not even moving me to say yes, yes. Who is, come on, yes, yes. Are we, is there any energy for yes, yes? If we need energy, you, Esther, you need to say yes, yes, because your energy is not giving me a yes, yes. So what is your
Because
yes?
I'm not
Give me your
sure we are
yes.
back yet.
Okay.
That's why.
No, Esther, I still need a yes, yes, yes on you. Okay.
Okay, yes, yes, I am back.
Yes,
So
yes.
anybody who is back, if you're back and you're here with us, you are back from your break, say yes, yes in the chat.
Yeah, absolutely. Thank you. All right.
Okay, welcome back, everyone. For those who are here, for those who are yet to put their yes, yes in the comments, we are waiting. Or right now, just give a thumbs up to anybody's comments you've seen or somebody you like to connect with. Say hi to them in the chat, or just let us know you're here. So without wasting more time, because the day has been going very great and it's been an amazing day, and we are learning so much and we're ready for more. And if you are here and you're ready for more, you can also put ready for more in the chat. Next, we have Bukola Ayinde, Mrs. Bukola Ayinde, speaking about transforming trauma care, tackling cultural and religious bias in African disability support. Mrs. Bukola Ayinde is the founder of Diary of a Special Needs Mom initiative under P413 Foundation. She's a lawyer, storyteller, film producer, disability inclusion advocate, and social entrepreneur. She holds a Bachelor of Law degree and a Master's in Managerial Psychology, starting her career as a litigation lawyer before becoming a training and development consultant. Mrs. Bukola is a neuro-linguistics programming practitioner and a trauma care coach. Drawing from her experience as a mother of a special needs child, she advocates for families with children living with disabilities in Nigeria, focusing on inclusive education and disability inclusion. She has published 6 books to raise disability awareness, including My Name is Nimi, translated to 6 languages. Our current project, a play titled The Gods Are Strange, promotes diversity and inclusion and has been staged at Corona Secondary School and in Jos with Goethe Institute. Bukola has written for national newspapers and Bella Niger on disability inclusion and produced 2 documentaries on inclusive education and a short film on the mental health of parents with special needs children titled Mindshift. As a passionate speaker, she engages government, corporate organizations, schools, and religious centers on disability awareness and has mentored over 100 mothers of children with special needs. She lives in Lagos with her husband and 2 daughters. Welcome with me, Mrs. Bukola Ainde. You're welcome, ma'am.
Thank you very much. Hello, everyone. It's a pleasure to be here. Thank you, Professor Marino, for putting this program together. It's been an awesome 2 days. And this morning, all the speakers, thank you for speaking from your heart. There was so much to learn, and there is still so much to learn. Okay, so my topic today, I'm not going to dwell into what trauma is, what trauma is not. We've heard that all morning, and I have just limited time, about 15 minutes to go through my slides. So I'll go straight into my slides and my topic. So my topic is transforming trauma care, Tackling cultural and religious bias in African disability support. Okay, next slide. Is someone okay? So I can see it myself, so I'll do it myself. Thank you. So I'm going to introduce, this topic by saying that navigating disability management and caregiving, that is, those that care for persons with disability in Nigeria and across many African countries, is quite challenging. Before I went into this proper, when I was just, a mom of a child with special needs, I thought the challenges were peculiar to only Nigerians in Africa. But I have spoken to moms from different countries in Africa, and I realized that the challenges are the same. So both the caregivers and persons living with disabilities require trauma care. However, there are different obstacles preventing them from getting the help that they need. Okay, so understanding the disability management and the trauma care. When a family, let's say a mother and the father, gets the child's diagnosis, the proper way, the proper stage, the proper thing to do is that they should go through counseling. They should go through the trauma care work. You have received a news that your child has a disability, a life-threatening, disorder. A parent is devastated. So that process, that time, they need to grieve. They need to grieve, the child that they wanted but didn't get. They need time to process what is going on with them at that moment. They need time to heal. They need time, to understand, how is this new dynamics going to affect my marriage? How is this going to affect my life? Being a Nigerian, being an African, how is this going to, affect everything that I do? However, there are so many things that we're going to look at now that prevents parents from healing, from accessing trauma care and just trying to walk through a maze to figure out how to parent children with disability. Okay, so in discussing those barriers, those biases, we're going to be looking at the cultural, religious biases in disability support. So biases in many African cultures often view disability as a result of spiritual failings. It's either you have not prayed enough, it's either you have done something evil. In some parts of Nigeria, they believe that a woman who gives birth to a child with special needs committed adultery when she was pregnant. And that is not just all. There are so many other beliefs that I have heard. Some say it's as a result of or punishment. So this passion leads to stigma and prevents families from seeking help as they fear judgment or exclusion. So understanding these biases, as a trauma care professional, is the first step towards creating supportive, inclusive systems that promote a healthier view of disability. Okay, so stigmatization of families and parents of children with disabilities. Now, families with children who have disabilities may experience social stigmatization and isolation. I've had moms say to me, oh, since my friends knew that I have a child with special needs, they don't invite me to parties anymore. One woman told me that the landlord asked her to pack out because her child looks like a snake, in quotes. This child has a mobility issue, so because the child cannot walk, the child crawls. A particular, so there are different things that happen in the community, in the African community, that makes parents to hide their children. because of that. I've heard where someone said, oh, if you touch a person with disability, the first thing in the morning, it brings bad luck. So we're dealing with superstitions. We're dealing with, myths, different things that's in the African society. And we have emotional and physical trauma of caregiving. Now, caring for children with special needs, there's the emotional angle to it, there's the physical angle to it, there's a financial angle to it. And parents experience exhaustion, worry about their child's future, and often face a lack of support, leading to caregivers burnout. So there's so many challenges in caring for children with special needs. However, they already have the stigma, they have the exclusion, they have the fear of what is going on around them. So the impact of these myths and misconceptions about disability, it brings fear of the person who has a child with disability. Number one, they're hiding the child. So I don't want people to see that I have a child with disability. So will hide the child. You have the secrecy around the disability. Oh, it's still out of the fear. Nobody should know. Nobody should know. So you can't access the help you need. You can't access all the care you need. The trauma care, you can't access it. You're going through depression. You're worried. Your health is failing. Mentally is failing. But you're hiding everything because you're afraid of discrimination. You're afraid of, oh, what will people say? In Africa, we're so into what will people say. What will people say? I asked a particular mom who said, oh, my child is exhibiting this and this and this. I said, okay, go for assessment at the psychiatric hospital. And she was like, God forbid, a home for mad people. The way we associate mental health with something so ugly is the way we shrug from getting trauma help. Like, oh, it has to do with the brain. I don't want to be associated with anything mental. So the myths also hinder acceptance. Acceptance doesn't mean that, because in Africa we're very religious. So I've heard people who are religious say to me that once I have accepted that my child has a disability, that means that I don't have faith. So I would always go from the place of, continue to pray. Accepting that your child has a disability doesn't hinder you from prayers. It just helps you to know. I'll tell them that it helps you to know how to pray, then how to handle, what your child is facing, then inability to access resources such as trauma care. If you are hiding your child, if you are hiding your trauma, if you are hiding the fact that you need help, so how are you going to access the help that you need? Then, like I've been saying, due to stigma, families keep their child's ability a secret, fearing social exclusion. In Africa, we are built in communities. So we have the age group communities. You have in the church, even in the church, they have different societies in the church. In the mosque, they have the different society. Age groups have the different society. And we are always so scared of being excluded. So anything that will exclude us from society, from groups, from communities, my God, we will fight against it, even when it will cost us our mental health. So now, how can we, as trauma care workers, how can we penetrate the African communities? Because trauma care services in African communities often overlook the unique needs of families of children with disabilities. Now, let me even go to the religious, sector. Let me give an example that comes right home. Because I'm a Christian, so I will use the church. In the evangelism department, I have seen people who they have departments for that reach out to persons in the prison, to cater for them, their emotional need. They reach out. They have a unit for maybe the hospital outreach to cater for them. But I'm yet to see a church that has an evangelism unit that caters for, the spiritual and the emotional needs of persons with disability. So as much as we see trauma care services, we see, for maybe the girl child, we see for women, we see for communities, we don't really have so much in that aspect. And there is a lot of work in that aspect. So if you are on this group today and thinking, okay, where do I want to specialize in my trauma work? There is a lot of work in Africa, as regards the disability care, because people and that particular community, they need a unique kind of service that meets the needs of the families of children with disability. An inclusive trauma care approach recognizes and addresses these families' specific emotional, social, and physical needs. Then specialized counseling and peer support groups that focus on the realities of disability as well is needed. Okay, so promoting cultural sensitivity in trauma care. Trauma care providers must be aware of the cultural sensitivities to better support families in overcoming biases. So when moms come to me for, and for counseling, and they come because, like I said, in Africa, we're very religious. And they come in the aspect of, oh, the enemy is my enemies that work. I need to pray, I need to fast. I would always say, yes, you need to pray and you need to fast. But your praying and fasting can work hand in hand with your trauma care work. By caring for yourself, right? Because I would say that you cannot give what you do not have. If you do not care for yourself as a caregiver, you cannot care, for your child. So I would tell you, what? Continue to pray, continue to fast. Do not demonize your child in the process, but you need to also work on your mental health. You need to also get help for yourself. While you're getting therapy for your child and all, you need to get help for yourself. So part of building support networks within the communities. So because you realize that another angle is that when the special moms come, for trauma work, they will tell you to focus on their children. So when Apostle Busola was saying that, in the church, when parents come with their children and they will say, pray for me, but focus on my child. That is the same thing that translates into working with, parents who have children with disability. They will tell you, focus on my child, any therapy, whatever it may be, focus on my child. I can care for myself, and we just gloss it over. But like I've said, you cannot give what you don't have. If you don't, get yourself to that state of having an harmonious life, where you have healed. And, when you start working with these parents, you realize that the trauma work is not just on, I have a child with disability. It comes way, so you like Prof said in the morning, it's way beyond that. So you need to go back to the history of, the childhood history and realize that, the having a child with disability is just one level. You will begin to unearth so many things. But, for you to even be able to penetrate these people, you need to work with the community leaders. Those are the people that have that are able to influence the people in the community to come out and know that disability is a medical condition, and it's not that the enemies are after you or you did something wrong or it's a form of punishment. We need to reach out to religious leaders, whether we like it or not. We need to keep knocking on those doors and speaking to whoever you have a relationship with, whether it's the imam, whether it's the pastor. You need to keep knocking. And we also need to, you'll be shocked that there's so many medical doctors who do not work with children with disability, who do not understand it. So apart from, we need to, advocate people to what the essence of trauma work, the essence of trauma care, for persons caring for children who have disability. We need to work with NGOs, for them to penetrate in advocacy, talking to them, the essence. People need to know the essence that I will keep saying it, you cannot give what you do not have. And that is why one day I got a call. A woman called me and said her husband said he wants to kill the child. And I asked why. And they said they have been caring for the child for 2 years, and the child has not healed, So he's tired of wasting money and he just wants to get over and done. And, and I'm like, this is what we're saying. We need to keep, telling people that, okay, disability in most cases is a long-term, treatment. It's a long-term disability. I mean, it's not something, it's not like malaria. People need to understand, okay, so what do I need in this process? I need someone to hold my hands. I need someone to help me understand that I need self-care. I need to care for myself, not lose myself in the process. I need someone to help me forgive. I need someone to put me through, the process of forgiveness. Like Prof said earlier, forgiveness is not for others, it is for you. I need someone to hold me in knowing that I can overcome all that has happened to me. It's not something you can do alone. You need somebody to walk that road with you. You need a trauma care professional to walk that road with you. So other things that the government can do is like the policy reforms for equitable access to resources. So what I'm saying here today is that for us to be able to penetrate the trauma care in Africa, we need to work with different sectors and advocate the essence, because people that even need it do not understand that they need it. And even if they understand, they are too, will I say, they are cocooned in shame, misguided ignorance, and feel that it is trauma care, going to a trauma care professional is, the same thing as saying that they are mad or they are below, it's negative. So we need to rework the mind through advocacy to reach out to people that need what we do. So like I've said, empowering families through education, through advocacy is very, very essential. And in 2 minutes, I'll just talk about my own story. I have a child with disability, and that was what has brought me through this road. And initially I wanted to leave the country, but my husband and I decided to stay here. And in staying here, we have been able to make it work. We have thrived. And I have, in my own life, I have gone through series, I would say series of, therapy. I went through series of taking courses, to actually rediscover myself. I had to go through therapy. I had to heal, and it's a process. It's a process. And for us today, we're advocating for persons with disability in Nigeria through storytelling, through community support system. We've reached over 100 mothers, in different states in Nigeria today, and we keep doing the work, knocking on the government's doors, on religious places and saying, open your doors. These people, as a Christian, I would say Jesus died for them too. So these are the works that we are doing to ensure that people do not um, people do not see disability in the negative aspect, thereby, keeping them locked away from the care, the trauma care that they need. I'm trying to hurry up. So, in summary, by breaking down and addressing each of these points that I have mentioned, we develop a framework that not only provides trauma care for families of children with disabilities, but also works towards changing the cultural and societal structures that perpetuate stigma. Thank you.
Excellent, excellent,
Thank you.
excellent. Well done, well done, well done. Look, I mean, if there's somebody who can speak on disability and parenting and all the stuff that goes with it, it is you. You've taken this work and you have not only personalized it to the way that's transformative, but you've also used it to change systems. So published like what, a few books that have been adopted into the school systems. And so those are powerful things that you've done. And I've also seen you advocate for your daughter. Like, you were a powerful advocate for your daughter. And so thank you for bringing all the experiences and the knowledge about this, and for sharing it with us today.
Thank you. Thank you.
All right, I
Okay.
invite up the MCs. Okay, there you are.
Okay. Thank you, Mrs. Ainde, for that very insightful and deeply moving presentation. And truly, we really need to hold our government accountable. I just remember the 2030 agenda for the SDG goals, and it says leave no one behind, and it includes everybody. We are supposed to involve everybody in whatever we're doing. I think we should begin to carry this message of mental health to them and tell them that, okay, look at what you have said in the SDG goals, and you have said it, so you have to do it. Thank you so much once again, Mrs. Ayende. We hope that people actually make a difference with what we are hearing today. Don't go away. We are still going to another interesting topic. We still have two vital speakers you don't want to miss. Next up, we have a trauma care coach and counselor. Her name is Miss Ganiat Karim, who will be speaking to us about trauma care for non-medical mental health practitioners, integrating spiritual alternative therapies in Nigeria. I'm going to be reading her bio. Ganiat Karim is a multifaceted professional with nearly a decade of experience in child welfare, communication, and public health. She is a dedicated social worker and trauma-informed counselor with a leadership and management certificate from the University of Washington Global Health. Ghanaia's extensive education and training, including courses at JARS Institute, the University of Alaska, Fairbanks Medical University of South Carolina, United Nations, and the Center of Disease Control and Prevention, have equipped her with the expertise in counseling and psychosocial support services with a particular focus on adolescents and young people. Her recent achievement as a recipient of the Women Texters Fellowship for Product Management underscores her commitment to leveraging technology for social impact and mental health improvement for children and youth. Garnier is adept in social and behavioral research, program management, human-centered design, public speaking, and finds joy in writing and dancing during her leisure time. Welcome, Ms. Garnett, with me. Thank you for joining us today, Ma. We're happy to have you. I'm guessing her network.
Hello, can you hear me?
Yes, we can. Welcome, ma'am.
Good afternoon. Good
Good
afternoon,
afternoon.
everyone. Good afternoon, the esteemed guests, mental health professionals, and the audience.
We
Good
can't
afternoon.
see you. We can't see you,
Yeah,
Miss
I
Ganiat.
don't know what happened. I don't know what happened to my video. Why can't I?
Okay, we'll just give her a minute to try and get back in.
Okay, while we wait for Miss Ganiat, for those of you who are following, if this has been, oh, she's here now.
Yeah. Hi, Hester. Hi, good afternoon,
Hi,
everyone. My name is
Ganiat.
Ganiat
We are glad to
Karim.
have you.
And okay, please, can you share my slides so I could work with that? So my name is Ganiat Karim. I'm a social worker by profession, and I specialize in trauma and mental health counseling for children and young people. I currently work in the public health space, and I'm also the founder of Mindful Wellbeing Foundation. So for some of you who might like to speak to a counselor, a trauma counselor, a child welfare and mental health counselor, please reach out. Okay, so today I'll be talking about trauma care for non-medical professionals, integrating spiritual and alternative therapies into the Nigerian healthcare system for trauma care. Who are the non-medical professionals? So these are my icebreakers. So for some of our audience, I have an important assignment for you, which while I'm taking the class, while I'm taking the speech, you are going to do something for yourself. Write down one major experience, whether it's an experience in a wakeful state or dream state that frightened you till now and affect your thoughts, feelings, belief, and behaviors. Who did you speak to and why did you speak to them? Please drop your comments in the box and let's know, share your experience. Let's know what experience you've had, whether in a dream state or in a wakeful state. Who are the alternative healers? Well, for some people, alternative healers are people who practice yoga, those who guide during meditations. But alternative therapy also extends to spiritual leaders, especially the ones that heal within the church, within the mosque, and even in the traditional health system. A lot of the speakers, they've delved into the impact of trauma on physical and mental health and behavioral health. But what about trauma from um, trauma from spirituality? Apostle Busola mentioned something which I was like, oh my God, this is beautiful. But I'm going to extend on that since that's what I'm supposed to talk about. She said that there are a lot of dreams that people have that could be an experience or a nightmare from a traumatic experience. And she cited an example with dreaming about while you were in school, which had been misinterpreted by a lot of spiritual leaders as probably backwardness and stuff like that. So I'm going to start with, okay, spiritual healers. In the Muslim community, the majority of spiritual healers are usually people who are versed with the Quran verses and also with some with practices of Sufism, which is like an Islamic meditation, where some just focus on the Sunnah, which is the Quran and Hadith for healing. And some of these practices extend to using herbs, torture, aside from the prayers. In the church, we have the Pentecostal churches and we have the Word Garment churches. They both they differently have their own system of healing. For the Pentecostal churches, they will mostly focus on deliverance, prayers, and maybe use of water or oils like olive oil. And the Word Garment churches may extend to prescribing soap and even oils and even torture. So I'm going to be sharing experiences later when I get to the slides. Then for the traditionalists, we all know that the African traditional religion also has their own practice of healing, and now they've dealt with either physical, mental, behavioral issues, and even spiritual issues. So the purpose of this is that we cannot ignore the fact that the body is a tripartite balm of both body, soul, and spirit. So when the body is being healed and the mind is being healed, what about the soul? Then when adverse events happened and people become traumatized or experience trauma, does it affect our spirituality, or it only affects just the mental or the behavioral part or the physical part of us? So this is what I'll be talking about in this program, that trauma can extend even into the spiritual world. What you experience in your physical world can manifest as nightmares. One of the symptoms of post-traumatic stress disorder is nightmare, because some people may not experience the effect of trauma, especially when it's something that happened a long time ago and is already in the repressed memory. They may not be able to relate it to it in the physical form, but in their subconscious state. And subconscious state is manifesting in the dream state, where people may experience that someone wants to rape them or someone rapes them in the dream. We also have the Aba Ilas, who are not necessarily Babalawos, because Babalawos are the Ifa priests. But we also have people called Onishegun in Yoruba, that they only deal with healing spiritually using herbal concussions, infusions, drinks, isolation of their clients and other ones. We have the yoga guides, I've spoken about that. We also have the hypnotherapists. The hypnotherapists focus on using verbal repetition and mental imagery to help their clients control their reality. We have the energy healers, and we also have the acupuncturist. Acupuncturism is something that is gaining stand, especially in the Islamic world now. You see a lot of Islamic healers. They do something called ijama. Ijama is like using a very big tube that looks like a syringe kind of thing to draw out negative blood or bad blood from the body, especially when you experience pain or when you experience headache. Even bees are now a form of healing. People who have frequent migraines or headaches, they use bees to sting the particular spot where people experience that pain. If it's a stomach pain, maybe you've always had serious stomach troubles that probably does not have any link to medical issues and stuff like that. And you find out that, okay, these days are somehow worked. Now, when we talk about non-medical practitioners, we have the spiritual healers, we have the coaches, and we have the pet healers. Even dogs and cats have also been found to be very therapeutic for people that use them as pets, and it's been a study going on to see how does this pet helps in healing process. Next slide, please. So as human beings, especially in Africa, where we are very religious, we are closer to our spiritual leaders or mentors than even the hospitals. A lot of us, when something happens to us, we tend to look at it from a spiritual angle first before we go to the hospitals. We find it easy to speak to our spiritual leaders, whether our pastors or imam on phone, especially when it comes with having a dream. Now, there are a lot of things that happen with dream or unconscious states. Just like I said, it could be something, it could be a spiritual attack, it could be a spiritual experience. Myself and two of my colleagues, like Dr. Rogers and Ivy Smith, we are working on a book actually to speak extensively and to collect information and insight from people with lived experiences of spiritual experiences, spiritual attack, and how does it come, how does it interplay with mental health and mental illness. So when the book comes out, everybody will be aware, and it's something you'll find very interesting in reading. Now, there are different kinds of alternative healing and therapies. We have mindfulness practice, which comes with practicing deep breathing exercises. We have even staying in nature, like going into the nature for a few minutes of your day is also healing. We have suffering. We have energy crystal or healing, we have meditation, we have beach relaxation, and we also have music. Now, some of you may wonder, okay, what is energy or crystal healing? A lot of people, like I said, this is basically talking about spirituality and different aspects of spirituality, irrespective of the religion that you practice. Some people use crystal to take out negative energies. I spoke about, when we talk about trauma, the effect it has in the body is negative emotions. It brings your negative emotions to the surface, which leads to anxiety and even somatization, like bringing out bodily symptoms like frequent headaches, stomach trouble. Trauma has also been associated with gastrointestinal disorders, especially peptic ulcer, gastric ulcer, because of the acid reflux. So there are a lot of things that is associated with experiences of trauma. And like one of the speakers said yesterday, trauma is not what happened to you. Trauma is a result of what happened to you. And when an adverse event happens to you, if you don't have good protective factors or you didn't go for therapy immediately, there is bound to be a resurface trauma. You could also experience vicarious trauma just by witnessing or hearing about an event that didn't happen to you or you did not even witness. So there are lots of ways that you can help yourself to manage the trauma, even though it is always better to speak to a professional. And that is why this topic, non-medical practitioners like the alternative therapy healers and the spiritual healers, we need to extend trauma-informed care to them, because these are the people in the community. These are the people that the community has found or trust over time. These are the people that are closer to families, that are closer to individuals. These are the people we seek for advice from. So when we train this set of people in trauma-informed healing, they will be this first the first aid, trauma first aid, providers for people who experience adverse events even before they become traumatized with it. Now, how does trauma show up in different spheres of life? I've mentioned the way it shows up in physical, mental, behavioral, and spiritual. In the physical one, it shows up as chronic diseases or even physical symptoms like migraines, like stomach pains that I've mentioned earlier. In mental spheres of life, it could show up as PTSD, anxiety, or mood disorders. And when it comes to spirituality, you see people experience loss of faith, existential questions, like people begin to question why they exist, what is their purpose in life, and even nightmares. There are lots of people that they've been told that they have spirit wives, spirit husbands, but in reality, when I begin to do my research, and as a result of the kind of clients that I'm attracting, I discovered something profound, which I'm going to talk about in the slide that talk about the story. And also in behavioral, it manifests as alcohol addiction or even substance use. So when you see people behave in a certain way, don't be quick to judge them as being bad. The first question that should come to your mind is, what happens to this person? How did this person become this? What can I do to help or support this person in becoming better? Like in psychology, they'll say, oh, adult personality is formed. But personality is different from behavior. You see a lot of people say, oh, this is who I am, this is who I am. Is that really who you are? Or you've been traumatized, or you have trauma from childhood experiences and you need to heal from this trauma. So next slide, please. So true life story of a trauma survivor. So I had a client recently who was initially married. She had 2 kids in a previous marriage. She got divorced and entered into another marriage. I think 2 years into the marriage, husband died. So her husband is a US citizen. She was supposed to go, because the husband died in America. She was supposed to travel to America for the burial and stuff like that, but she was denied visa. So in the course of therapy, like trying to heal from the shock and what her life will look like moving forward, because she wasn't working. The husband didn't allow her to work. He provided everything for her. And this woman disclosed something about experiencing having spiritual husband. And she felt that has been what is happening to her, that because she divorced the first time and the second time now her husband is died, she had gone to she's a Christian, so she had gone to pastors who told her she has spirit husband and she needs to get rid of them. But when I introduced trauma, when I began to assess using advanced childhood experiences skill, I discovered that this girl experienced sexual abuse as a child. She was raped as a child. She couldn't even remember that she was raped, and that is why a lot of psychotherapists or a lot of healers introduce hypnotherapy. There are some events that have been forgotten or repressed. We call it repressed memories, and it's one of the defense mechanism not to try to let go of events that hurts or that are very painful. So she didn't realize that, she didn't remember that she was abused until we began the sessions before that came up. And I began to wonder, what if the experience she had as a child was what is manifesting in the spiritual world as having a spiritual husband? What if the reason why this woman was divorced is because she's attracted to people that are also traumatized? For instance, I don't see a reason why a woman should not work. But a lot of men are suffering from inferiority complex and they believe that, oh, if I allowed my woman to work, she's going to be exposed to a lot of men because she's a very beautiful woman and stuff like that. And I begin to wonder, at the end of the day, we were able to focus on the sessions, incorporating both spirituality, culture, and the psychotherapy part of healing to help her get better and process her life for what is next. So next, okay, so what are the self-help tips for healing from trauma? A lot of people when I delve into spirituality and trauma and mental health, I realized that there are a lot of people that have been so quiet about their spiritual experiences, and the fact that some set of people have been stigmatized to be either demonic according to our religious practices, whereas these are just things that people had gone through, they are going through, or they have gone through. Like my current research and experiences talking to people had made me understand that there is even what is called ancestral trauma. You know, just like we have intergenerational trauma, we have childhood trauma, we also have ancestral trauma. And that is what makes me now believe that I think that reincarnation might be real. I'm sure if it goes against some of our religious practices, this is a learning platform, and I'm just sharing what I've learned from personal experiences of people, myself, and my research. I discovered that there are some experiences of trauma that it wasn't even this present body that undergo that particular event, but something from the past. I have seen someone told me categorically that her parents believed that she was a reincarnated being of a particular woman that likes a mother as a child, and the woman said, I'll come back as your child if I happen to come back in another lifetime. And when this child came into the world, she had that same mark, the pregnant woman who was always obsessed with her mother as a child as. Now, the religion might not explain some of these things to us, but it does not mean that it is not happening. So some experiences of people are not even as a result of what they had gone through in their own physical life in this lifetime, but as a result of maybe the spirits that they are incarnating, that they are reincarnating as, that has gone through, and that spirit needs to heal from it, which affects their own physical life. Now, that is why trauma-informed care or healing should be an integrated or holistic process, incorporating spirituality, physical, mental, and even behavioral together in the same space. How do you self-heal from trauma? You could do that through ritual prayers, either praying with the Bible verses, praying, listening to the Quran, recitation of the Quran, or listening to music. I tell people that there is no the same effect of listening to the Quran is the same effect you get in your body when you listen to music, you dance, or you listen to Bible verses, or even spiritual leaders preaching about stuff like this. We also have mindfulness and meditation. This is something that I do every day when I wake up, when I'm going to bed. I breathe in for as much as 50 counts now, but in a stretch of like 10 minutes. So there is also nature healing. Sitting in the nature alone, quiet your mind, closing your eyes, experiencing the beauty of creation, enjoying fresh air is also healing. It can help you with anxiety. It can help with panic attack as well. And it can also help with depression. There are people that in the Islamic, I'm speaking from this angle because I was a Muslim. So in the Islamic environment, when they begin to notice that someone is isolating, or you tend to talk to yourself, they believe that you are demon possessed. Whereas this person may actually be suffering from depression or going into depression. So we shouldn't be quick to demonizing. I don't even know where the idea of demonizing some certain set of people or events or a perceived problem that we don't have knowledge about, instead of helping people. These people are resolved into just being alone because they were being stigmatized. It's a stigma when you believe that some certain set of people, because they possess some powers that you do not understand, are demon possessed. And at the end of the day, even when you do all these things, it does not mean that they change the kind of person they are. It just changes their perspectives. This is something that happened to me personally. I've been a very different person right from my childhood. My parents know that. And there were some experiences that I had that made them believe that, oh, I was possessed. So I was being taken to Islamic healers for rukia, and they will recite Quran. They expected that there should be a demon speaking through me, so I'll be beaten and be said that, oh, tell me your name, tell me your name. And this is something that I was conscious of, and I was like, my name is Gania, there is no demon. So I keep mentioning my name, but they keep beating me in the process, hoping to get out the demon in me. I am not possessed. This is me. I just probably am not like every other child out there. This should be seen as a gift, not as something that should not exist. So we have sport and exercise, we have gratitude, we also have self-talk, self-affirmations. Like every day, try to say something positive about yourself. Think positively. Don't be quick into believing that you can't do anything. Believe that you can do anything as long as you set your mind to do it. Because the God who created you is a God of abundance. Is someone that is filled with everything. So he wants you to have that abundance because he created you in his own image. So why should you limit yourself into what you can achieve or how you should behave to other people? Next slide, please. I think that would be the last slide, I think.
I think that's your last slide. Oh, okay. Yeah.
Okay, yeah. So said this is my number for some of you who might be looking for someone to talk to about your spiritual experiences, about trauma, about mental health. Please feel free to reach out to me. And I'm calling on all the different professionals that are part of this program, policymakers. We need to find a way to incorporate alternative therapies into the healthcare system. Let people go through stages of healing. Let people speak to a spiritual counselor because they feel their problem is spiritual. And at the end of the day, if it is not, they pass on to a medical or mental health professionals. With that, people can gain holistic healing and feel better, not just about their mental or physical health, but also about their behavior and spiritual health. And that is what I call humanity. Thank you very much.
Thank you so much, Gani. It's always a joy to listen to you. And thank you always for sharing your story with us. That was such an insightful session. If you enjoyed the session and you're still here with us, let us know in the comment section. Tell us something that stood out for you. And we are still here. We still have two more presentations. So please don't go away. Thank you once again, Ganiat, for that. Next up is Mrs. Stella Emeka Okoli, who will be delivering to us some insights into addressing key barriers to trauma care integration within the African context. I believe she's here with us, and so I'm going to go on to read her bio. Mrs. Stella Chinyere Nwankwo became a mental health advocate following a personal traumatic experience that turned her entire life around. She has a BSc in Mass Communication and an MSc in Sustainable Development from University College London. She has over 2 decades of experience in social performance, communications, partnership development, and risk management. She has completed foundation courses in positive psychology with the University of Pennsylvania, a course in applied neuroscience and brain work with Dr. Sarah McKay at the Neuroscience Academy Australia, and trained as a trauma informed care professional with Professor Akin Dotun Merino JARS Institute in California. In her spare time, she researches and helps mothers with special needs children and women in difficult circumstances rediscover themselves to live a fulfilled life during life's extraordinary circumstances. She runs a free monthly webinar, Rediscovering You. She has been engaged in delivering messages and presentations on mental wealth by Rotary Club Airfield, Port Harcourt, Resident Doctors Association, River State, 360 Degrees Growth Community, and Lively Stones Nigeria.ng community. Welcome with me, Mrs. Stella Emeka Okuli. It's a pleasure to have you with us today, Ma.
Thank you and good afternoon. Esther, can you hear me?
Yes, we can.
All right, thank you. You always have a smile on your face. It's a pleasure. All right, before I just have like 3 slides. I like to do free flow, but I had to do some slides because it was required. So first of all, I would like to thank Professor Merino. Whenever I recount my life journey in the last 8 years, which was when my son's accident happened, I always find a pivotal place when I joined JAS. And I said to Professor Merino, I went to learn so that I can help other people, but I found help for myself. And I see myself as a JAS poster child. Yeah, and for me, trauma work really starts and ends with us. So if I want to summarize my presentation, it's all about you. It's all about us. It's every professional. I've listened very intensively in the last 4 hours. Every single thing that we've talked about revolves around us. It's you and I, it's you and the government, it's the government and the people. So we are the powerful instruments in the system. And one thing I will never forget, Professor Merino says, you are the tool. It's not the knowledge, it's not the notes that you have taken. When you get into the space, when you get into your office, when you get into your church, wherever you get to, see yourself as the tool, and the energy will come for you to help. So with that, I will be sharing a few insights around the key barriers to trauma care integration within the African context. All right, the next slide. What I have on my slides are not from a theoretical perspective. These are the things that I have seen in my own journey of trauma. If you want to see, at some point, I used to describe myself as where trauma lives, right? Because I had multiple traumas in succession. If I can have a minute to talk about my story at the end of the presentation, but in my mind, I see these experiences around some key areas, and I've divided them into the hard part and the soft part. So if you look at the slide that we have there, you see that the issues around finance, education and research, partnership and collaboration, and data are some of the key things that we don't readily have at the tip of our fingers. Both the person who is traumatized and the person who is providing the trauma care and the institutions, there is poor funding, there is paucity of data, there isn't enough manpower to carry out research. And even when the research has been carried out, like the work that Ms. Sayonde is doing, even when the research has been carried out, to disseminate it in the language and in the manner which every strata of the society requires it, remains a problem. So even where we have everything that we need to be able to integrate trauma into the African system, the issue around having the correct mode of transmission is still a barrier. Now, these are infrastructural or hard barriers to dealing with trauma integration in Africa. But beyond that, are the things that are within our control. All these things I've talked about, finance, data, collaboration and all that, they have to do with third parties. They have to do with things that you don't have control over, right? But if you look at the right side of my slide, you will see other soft systemic issues like our mindset, like our religious beliefs, like living in denial. Now, when you have this as your baseline, and then you have the superstructure of finance, paucity of data, poor collaboration across industry or even within the industry, it becomes a hydra-headed demon, because the mindset that we have is one of the greatest challenges or problems I have seen in walking through trauma. And Ms. Ayinde, she took the words out of my mouth. I have seen people tell me or behave in such a way that somebody who has cerebral palsy or somebody who has autism, they feel it's a communicable disease. And these people are educated. How can cerebral palsy be a communicable disease? How can autism be transferred from one person to another? It's not eczema. It's not a viral infection. Do you understand what I mean? So, and then you have this defective religious belief whereby, I point again to Ms. Ayinde, whereby there isn't even any mention of trauma. There isn't even any recognition of trauma in many religious societies, because it's anti-religion or it's anti-Christianity to agree that somebody has trauma. And so people hide their trauma. People pretend that they don't have trauma. People pretend that they don't have disability because of the wrong messages that people subject themselves to without going. I'll be speaking from a Christian perspective because that's what I practice, without going like the Berean Christians to check if these things that we are being told are true or they're just motivational speeches. So because people live in denial, or it doesn't present what they claim, they pretend that we don't have trauma. They pretend that we don't have disability. Meanwhile, you are living with it, or your cousin or somebody. I don't have the data offhand to know the 1 out of how many people that have some level of trauma or disability. And then the most critical aspect of it, like Professor Merino, I love this word, egregious, is the fact that people continue to live in denial. If you're not told that what you're going through is from your father's house, they will diagnose it from your mother's side. Hey, how about if we talk about it? And because of these soft issues that are underlying the trauma care in Africa, the ones that are now on top of it, which is finance, industry collaboration, and data, you can't do anything about it. So if you don't take out anything from what I've talked about today, let's rethink the way we think about trauma. Let's go to the next slide. Moving forward, in addressing those barriers, I would say, even if you go to Jazz Institute's or Professor Merino's website or Facebook, there's so much that you can learn free of charge, like free. It doesn't cost anything. The technology is there. So before we even start talking about policy, before we start talking about government, before we start talking about funding, let us, as many people who have attended this 2 days workshop, just go to Jazz Institute, right? And learn as much as you can for yourself. I don't think there's any jazz Just course I've not taken, except it came out this year. And I can still retake it because of the value and the volume of free information that is already out there. So let's sweat the technology. Secondly, awareness creation. I was so like overwhelmed when I went through my jazz training. I kept on asking Dr. Merino, what can we do? What can we do? She said, Stella, what do you do in your church? I told her, she said, start from your church. Tell your church members about this. So before we start talking about the superstructure, what can we do from where we sit with your children, with your cousins, we don't have to go to the moon to get what we are looking for. Moving forward, let's, as much as we can get online and the courses that we're taking, let's start to evangelize about the incidence of trauma in our lives and in the lives of people around us. And let's get people talking. There was a lady who spoke earlier in the day, and she talked about how she posted something on her social media, and it looked as if it didn't receive many likes or views, which is what people use to judge how effective something is. But later on, somebody who saw what she posted reached out to her and, and got some solution from it. So whether people are liking or whether people are viewing, let's just keep putting it out. If you go to my Instagram, my Instagram page, you won't be at loss as to what is in my heart about how evasive trauma is. So let's keep reaching out. Let's keep communicating in the church, in the mosque, whatever platform that God has given us. Let's talk about how, let's use the opportunity we have as being trauma-informed professionals to help people. And finally, let's start early. When Professor Merino shared with us what happens to the brain of a neglected child, a child who is emotionally neglected, it's unbelievable. What happens to a child between 0 and 18 years? It's unbelievable. So I say to people, anybody who has a child around the person, you have a divine assignment to ensure that by the time that child is 40, let the memories that you have created with that child be something that will help society. So let's start early in our nursery schools, in our primary schools. Let's look for opportunities, storytelling. I'm a visual learner. Find out the kind of learner your kids are or the children around you are. You have so much information on the internet. Like I say, go back to Jazz Institute. There's so much you can take free of charge to begin to influence where you are. And finally, on the last slide, which is actually my main, where I'm going to, is about you. Let's always start from us. Where are we in the system? In the educational system, in the cultural system, in the religious system? Where are you? Whether you've japa or you japada or you are still in Nigeria, where are you in the scheme of things? I always advocate, let's start from where we are to deal with any situation we find ourselves, right? So where are we in the system, in the loop of trauma care in Africa? Where do we fit in? How do we ensure that trauma care is elevated, is visible in our educational system? We have children still up to today do assembly in the morning. We can have 2 minutes to talk about trauma care in the assembly. After we read the national anthem, we do this, we do the pledge. 2 minutes for your health. In the cultural system, I'm going to ask Abby to play a 30-second clip. In the cultural system, there's something, I'm from the East. When I studied about it, it's called tapping, or how you release trauma from the body. And as soon as Prof started talking about Kasali, I don't remember the word in Yoruba, but I remember that when we used to play 10-10, and I looked for the video, and I just imagine how we can convert Ipoga, like this. Children play with it. How do you elevate it to trauma treatment in the African context and even beyond the African context? I see Japanese, they tap, 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 but we have our own indigenous systems that are already existing. How then, with the knowledge that we have of being trauma informed, convert some of these existing systems in our cultural system to help in trauma care. And finally, in the religious system, I've already talked about it. Let's open our minds a bit more and desensitize ourselves from living in denial and simply just pretending that these things don't exist. In rounding up, I would like Abby, if you can, to just play, I think it's a 30-second clip that I sent to you, and see how these kids, what these kids are doing. You know? Yeah. Okay, thank you, Abby. Thank you, Abby. Thank you so much. I'm so glad that we're able to play it. It was just yesterday that I was thinking, this thing Prof has been talking about, these things are just around us. And I want to challenge everyone. No matter what you've gone through, there is nothing as important as education. Educate yourself. There's so much free data or information out there. Everybody who is listening to my voice, if you haven't gone through JAZ, anything that has to do with JAZ Institute, I would say you're defrauding yourself. I can say that. I myself, the person you're seeing here, if you hear my backstory and the things that have happened to me in the last 8 years, there is no way by just sheer deceiving myself or denying or just thinking that these things are not real, I would be where I am. And I really want to appreciate Professor Merino for her authenticity, for her vulnerability, her whole team, and all the people who work with her. They are genuine. I mean, when you relate with them, you know that these guys are not just trauma informed, but they really care about people. And I say trauma work starts with you and it also ends with you. So with that, I hope I've been able to show how we can address these barriers starting from where we are as in today, right now, at the click of the button. Thank you very much for the opportunity to share with you. My name is Stella. 8 years ago, my son walked into somewhere to take out his Can you hear me?
Oh, am I here?
Yes,
yeah,
ma'am.
Yes. Oh my goodness. You know,
I was just rounding up with my story.
I had network issues after Gani was talking, so I wasn't able to finish up with her. I finally just got back, but about 10 minutes ago, and I was able to hear all of the stuff that you were talking about. I was like, yes, that's Stella. Yes, Stella, go. Your compassion, your passion, your tenacity, all these things that you do. I love it. You're a lover of the work that we do here, but you're just a lover of people too. So keep doing what you're doing. We just appreciate you. All right.
Thank you, Doctor.
So much. That was a great presentation.
Thank you. Thank you.
And I also want to thank Gani because I never got a chance to do that. Gani also came in, Ganiyat also came in and did a wonderful presentation, especially that about spirituality. Talking about spirituality, because we cannot talk about healing in the African context without addressing spirituality. Excuse me, without addressing spirituality. And for you to focus today on that was really powerful. So thank you very much. All right, MCs come back up. I think we have maybe one person left. All right. If you're not there, I could do it. Who is next? Dr. Nayet, Esther and Elizabeth, which one is coming up? Dr. Nayet, let's finish well, people. Let's finish well. All right, so Dr. Nayet, Dr. Nyamedi is going to come up next, and I'm hoping one of you can come up. Okay, there we go. I think I see. Elizabeth, there you go.
Yes, ma'am. Okay, thank you. I would like to say thank you to Mrs. Stella for the last presentation. Trauma care indeed is very important, is very key. It's very important also for us to integrate it into the whole sectors in the industry. The last part of her presentation, she said, where are you in the system? And someone might be wondering, but I'm a housewife. I don't really go out like that. What are you doing around your neighborhood? What are you doing with your neighbor that you're close to, that comes into your house or you go to visit her? You can start from there. You can start from your church. You can start from just seeing people on the street. You can start from there. Thank you so much. That was quite an informative presentation. Thank you. Thank you. For the final session today, we have Dr. Nayed, who will be speaking to us from indigenous to contemporary counseling, integrating trauma-informed approach into counseling and psychological care in Africa. I'm going to be reading her bio. Dr. Nayet's PhD is a Ghanaian licensed counseling psychologist with over 16 years of experience in counseling psychology within educational institutions and communities. She holds a PhD in guidance and counseling, making her the first Ghanaian female to achieve this distinction from the University of Education, Winneba. In addition to her academic roles as a senior lecturer, counseling psychologist, and teacher educator at the University of Education, Winneba, Dr. Edo Toga actively contributes to mental health as a crisis disaster response team lead with the Ghana Psychological Association. She has responded to various crises, including the Buduburam fire disaster and the Apham drowning disaster, while also providing online counseling during the COVID-19 pandemic. Dr. Edu Toga's expertise extends to training church leaders in premarital and marital counseling, and she has a rich background in crisis, abuse, and trauma counseling, as well as publishing articles in international journals and authoring books. Beyond her professional achievements, she is a dedicated wife and mother with a passion for gardening and design. You are welcome with me, Dr. Nayet. You're welcome, ma'am. We're happy to have you today.
Hello.
Hi.
Can I be heard?
Yes, but we can't see you, ma'am.
Fantastic. Can you see me now? Hello. Can I be seen now? Hello. Hello.
We still can't see you, ma'am.
Wow. So well, I'm super excited to be here, to be part of this third edition of the African Trauma Conference. I am super happy and indebted to Professor Merino for being the pioneer scholar in this front in Africa. I want to also say a big thank you to Abby, who has always been on us to make sure that we do the needful and do it right. I have tried yesterday, but it has been very hectic for me. I was not getting network. Today, I can't tell the number of times I've joined and dropped and joined and dropped. I'm just hoping that I would be able to go through this. I was able to catch some little bits of presentations from Bukola, from my own friend Stella, and I must say that it has been fantastic presentations. Thank you so much. And my presentation touches on from indigenous to contemporary counseling in Africa. And I want to, please, do you have my slide to share? Okay, all right. My slide is there. Right. So briefly, I would like to, this presentation is on the integration of trauma-informed approaches into counseling psychological care in Africa. The question is, I want to look at how has traditional or indigenous counseling practices been, and what is the contemporary approaches to trauma care, and how do we integrate these two? What is the converging point for us, because as Africans, there are still things good in our traditional practices that we can pick up and then use again in the contemporary trauma counseling. What are the things that are good for us, and how do we Africanize those that are contemporary, especially from theory to techniques and then practice? So basically, these are the things that I would like to talk about today. Thank you.
Okay, I think that our network has kicked her off, but we'll wait for her to get back in. We apologize for the network interruptions. Let's give her a few minutes. As we wait for her, if you have questions, comments, or anything at all, just put them in the chat box. Or if you're on Facebook, on YouTube, say hi to somebody that you recognize in the chats or somebody you want to connect with. Just say hello to them, tag them. Okay, our speaker is back. She should be able to join us shortly.
Hello. My
Hi,
network.
welcome back, ma'am.
Okay. So sorry, I my net dropped off, and so let me go on. Yeah. So we talk about the evolution of African trauma and how a trauma is pervasive in Africa. How do we then understand trauma in the African context and then trauma-informed care in the African context and contextualize these things? So we want to look at that.
Okay, we lost Dr. Nayat again. Please be patient. She'll be back shortly. Okay. You're muted, ma'am.
So here's what we're gonna do. Since we're almost finishing, is Stella in the house? Is Stella anywhere that she can jump back in so she can share her story? Because this is the last one we have, and I don't think Dr. Nayet's network will permit her to do what she really needs to do here. So she might just need to record that, and we can share it with our audiences. So, Dr. Nayet, we're going to have you record your session and then send it to us, and we'll send it to all the participants. Thank you so much for trying to do it. I know that she's doing this from Ghana, but she's doing it she had to travel to the village, so she's in a rural place. So that's why the network is not so good. But thank you for trying. So Esther, we're going to round this up. I don't see Stella either. Sorry, I did not know Stella was trying to share her story, people. I told him I had the network issues, so I just came up I didn't even and to thank her, because she paused and I thought that was the end of it. But Stella will also share her story, and we would also share with you guys. Okay, so those two things we will let you have. Thank you so much for participating in this. I want to take the time to, let's take the PowerPoint off, please. Let's take off the PowerPoint, remove the PowerPoint. Okay, can we remove the, okay, thank you. And we are full, okay? We are full. We have had so much. We talked about the cardiovascular comprehensive cardiovascular trauma module. We have done that. I was able to take you through all of the steps on that. Is of course, if you need the training, you have to come to us at JARS, and we'll train you, because it's brand spanking new. The goal is to get this into a best practice in the West and right here on the continent. And then thank you for all of the speakers. I don't want to start mentioning names, because I don't want to miss anybody. Unless Binke will help me. We had Mr. Joseph from Kabusa. Thank you so much for representing the commissioner. The great work you guys are doing in Kaduna, we really appreciate. And then we had we had all the students who came up to celebrate what they're learning. Thank you, Abdullahi Kaka, who Olu. Boluwatife and Elizabeth, thank you so much. You make us proud for all the work you're doing. This cohort has been amazing. You guys are doing a great job. We have about 40 something people in this cohort, and they are really doing the job. And then we have Mrs. Yinka Gunde, phenomenal sis of mine, who has done a great job here. She is a luminary in the education space in Nigeria. She is the founder of the Concerned Parents and Teachers, I think it's called, and it is a huge space on Facebook. And so we love all that you've done, all the words that you've spoken to us today, to be able to merge wellness, look at wellness in the context of our educational system. And then we also had the Apostle Busola Jegede. Oh my gosh, amazing. The speaking truth, like I said, speaking truth to power. Thank you. You're visionary. Thank you, because you are able to articulate what people don't want to say publicly. Thank you for doing that. And then we have Dr. Dr. Ajiboye, my namesake, Dotun, and for the powerful contribution in intergenerational traumas. And look, we're also from the same state, Ekiti State, right? And we continue to do good work together. Thank you so much. Ekiti State, hopefully, will also be a part of, it's not hopefully, they're also a part of the work that we're doing in Nigeria. And then we had who? Bukola, Mrs. Bukola in the Bukola is like I said, thank you for the work that you do. For in disability, she was able to very well express what was needed to be said, both personally and within systems. No, Ghanaians. Then we had Ganiya did a great job with the spirituality. And then who just spoke right now? Mrs. and Dr. Nayet. Dr. Nayet today, and hope you can show me your attendance, because this was class. Well done for coming. So we don't have any class this evening. Do not sign in. I am tired. We're all tired. We're going to go to sleep, go just to relax. All right. For my team, thank you for the MCs. Let's hear it for the MCs, Esther and Elizabeth. Thank you. You guys did an amazing job for just making sure that everything flowed properly. Thank you to Mrs. Adebimpe Oshinuga, who is my right-hand man here, our Director of Operations. Thank you very much. And also Director of Student Services. She wears both hats. Thank you for all participants who came from far and wide. We had somebody here from, what was that country yesterday? We had people from Europe that were here. We had people, from places that we didn't even know people were listening to us. So thank you so much. And everybody, it's time to woosah. On behalf of all of us here at JARS Therapeutic Institute and African Trauma Care Alliance, we say, Eshegoni. Thank you. Give me different languages. How do you say thank you? How do you say it in Igbo?
Nagode. Nagode in Hausa, Dalu in Igbo, Eshe in Yoruba.
Imela. Okay, Imela. Nagode. Other Nigerian languages. If you know them, put them in the thing. So we will see you guys next year by the grace of God. Next year is going to be person. So if you need to save your money because we're coming here in person and we're going to be together. All right. Father, we thank you let's just close in prayer. Father, we thank you for this time. Thank you for the ability to finish properly. Thank you, Lord. We give you all the glory and all the honor in Jesus' name. Amen. All right. Thank you all. Let's get,
well
we
done,
have to
everybody.
All right. Yeah, let's end the stream. End the